Uh, yes, doctor. I used to smoke, but right now I'm not smoking.
Very good. And do you drink alcohol?
Yes, doctor.
Okay, and I hope it is within the social limits.
Yes, doctor. I drink occasionally, doctor. It is within social limit.
Okay, and may I ask what do you do for a living?
Doctor, I'm a retired army officer.
Okay. So how is this affecting your life? This symptom of yours, the backache?
Yes, doctor. It is affecting a lot, doctor. I cannot attend my gardening is my job, but right now I cannot attend my gardening,
Mhm.
doctor. I'm a retired person and I have to pass my time by doing some activity. Due to seeing this pain,
Mhm.
I'm feeling some difficulty in doing gardening.
I can see that this is really troublesome for you. And as I've told you, we'll have a solution for this by the end of our discussion. I would like to ask you, do you drive?
Yes, doctor. I tried.
Okay, so this must not be affecting your driving. Am I right?
Uh, yes, doctor. It's not that much of a big thing.
Okay. Have you underwent any surgical procedures in the past?
No, doctor.
Okay. I mean, no procedures and no blood transfusions also.
No, doctor.
Okay. Uh, yeah. So I would like to examine you now.
Okay. What do you want to see?
Yeah, I would first I would do the local examination. I would look
Okay.
at the site of the pain.
Yeah. How
Then
you want to check the site of the pain?
I would expose that area. Ask the patient to expose that area. I would see for any redness
Yes.
or any visible
Absent.
any absence. Okay. Then I would gently try to feel the area with cotton or ask the patient if he's feeling any tenderness.
Yes, I feel pain there.
Okay. Uh, okay. Then because there's pain, so I won't ask the patient to move this thing. Then I'll do the general examination. I'll look for his nails for any
Okay.
obvious nail changes, any
Absent.
clubbing of any absence. Then I'll check his pulse also. Then
Normal.
his blood, okay, blood pressure.
Same as given outside.
Okay. Then I'll check for his hands for any thickening of the hands. Then also
How to
extensive
check for thickening?
aspect. Thickening, I'll ask the patient to just pinch his skin below the elbow and above the elbow also.
Absent.
Okay. Then I'll ask the patient to show his both elbows to me to look for any rash there or anything there, any nodules or anything.
Absent.
Okay. Then I'll have the head examined and see for any patches of any alopecia, any hair loss. Then
Absent.
then
2 minutes
I'll
left, doctor.
yeah. Okay. So do you have any okay the do you have any concerns?
Doctor, why I'm having this back pain, doctor?
Okay. So after questioning you and after examining you, I think that you have this as you are taking this injection flutamide for your prostate cancer. I have two three possibilities in my mind. One thing is that due to this flutamide, you have weakness of your bones, and that's why you had this. You might have a fracture of the one of the your backbones, and that is causing you pain. This might be there. The other thing is that while working doing gardening, you might have that there is a disc in between our vertebra, so that might have this displaced from its side. And the other thing, the third thing might be a possibility that you might have a recurrence or any seeding of your cancer which you were taking treatment for. Are you getting me?
Yes, doctor. Doctor, do I need admission?
As you have this pain and we need to evaluate you and evaluate your condition, so we need to get you admitted and we need to run some scans on you because this might because we don't know the exact cause, so unless and until we evaluate you and assess you and be sure what is there, so we need to keep you under observation.
Okay, doctor. And I will talk to my consultant. In the meantime, he will come and
Yeah,
see you. You have to tell. Yeah.
yeah. So I'll talk with my consultant and then arrange something for you so that we can have a decision about you. Any more
Okay,
concerns you
doctor.
have?
No, doctor. Thank you, doctor. Doctor, your
Yeah,
time's up.
thank you. Okay, thank you.
So, doctor, now the time of cross question. So, doctor, do you have any diagnosis or differential diagnosis?
Sir, I have differential diagnosis.
Yeah, what will be the differential diagnosis?
Okay, so my differential diagnosis would be osteoporosis due to the flutamide injection and osteoporosis induced vertebral fracture. This is my first diagnosis in this case.
Okay.
The second diagnosis would be it could be due to the metastatic CA process, might be recurrence there. So that might be a possibility that he has some seedings, some mets deposit there that cause the collapse of the vertebra, and he's having pain.
Okay. Anything
The
else?
third thing is that it could be a prolapse intervertebral disc while
Okay.
gardening in metastasis. And a rare
Okay.
possibility could be but septic arthritis, but at least likely because 3 days fever is not there and maybe there, but
Yeah.
I'm not sure.
Yes, doctor, tell it. Septic arthritis can be there, but against
Yeah.
that, I have not got any root of infection or any site of
Right.
injury of the bugs
Site of
or
injury, I
any
couldn't.
history.
Yes.
Yeah, or any history of fever.
Okay.
You can tell. Okay, I'll
Okay.
explain you in the later part. So,
Okay, sir.
what are
Okay.
the positive physical findings you have got from this gentleman?
I have found that, sir, he has shown a tenderness at the lower area of at the lower spinal column, lower end of the
Okay.
back, lower back. And besides that, I couldn't find any positive physical findings. As he was having pain, so I should have asked him to walk. And during the history also, he didn't give any difficulty in walking or anything else of that sort. So otherwise, I don't have any other positive findings, sir.
Okay. Did you examine the lower limb?
Lower limb, I didn't take that.
Yes, totally missed it. Okay, I'll tell you.
Uh,
So,
okay.
how will you investigate?
Besides the basic investigations, I would like to do a X-ray of the lumbosacral spine. Then I would also like to do an MRI of the spine also to look for any mets or for any fracture or any prolapse intervertebral disc. I would do a bone mineral density scan to look for to rule out osteoporosis. Then I would also like to do the basic investigation like the complete blood count and vitamin D and calcium levels. Then,
Yes,
yeah,
that's all, doctor.
it's okay.
So, how will you manage?
I would keep the patient under observation. After, as and when the scans will become, then I'll educate and counsel the patient. Then I will form a multidisciplinary team involving neurosurgeon and the orthopedic surgeon also. And then we'll for his pain, we'll give him painkillers, simple painkillers like paracetamol, NSAID, and this thing. And also we'll ask him to not to take some rest and also provide some spinal belt for his for support. Then for his osteoporosis, we'll give him calcium and bisphosphonates. And
Okay. So,
yes.
doctor, I'm telling you some tricks that to tell in simple. It is not needed to tell that we have to keep the patient at the observation room during cross question. You can start with the education and counseling, forming a multidisciplinary team, then treatment of the underlying cause, treatment of the complication. After that, pause for some time. Let the examiner ask you the question. Then the examiner asks you, suppose this is the diagnosis is osteoporosis. What will be the management? Do you understand why I'm telling to approach it this way? Because if you tell all the answer in one go, the examiner will jump with another question. So let it be cool. Let that time pass away. Otherwise, the examiner will start questioning again and again.
Yes, sir.
Okay. So that is the way. So let me start the analysis. Dr. Sapir, are you there?
Yes, I'm there.
Okay. Let us analyze Dr. Anwar overall. So it is a case of low back pain. It will be written here in this way.
Okay, sir.
And the diagnosis will be written in this way. Like this is osteoporotic fracture. So there are some tricky candidates who will be able to see the diagnosis from the hand of the examiner, but it is not possible. So regarding physical examination, how will you like to evaluate Dr. Anwar? Dr. Sapir?
During physical examination, as this is a low back pain, one
Yes.
important question was to evaluate the gait, ask
No,
for
doctor,
gait.
I'm okay. Let me start, doctor. Actually, I'm telling about the physical examination skill. We have to discuss one by one skill. Regarding physical examination, what are the things you would like to tell about the comment about Dr. Anwar? And if possible, try to format the triple CA. That is confirm, cause, complication, and association. Please tell it, doctor.
As to confirm the case.
Yes.
To confirm the case, we examine the site of the pain first.
Yes, Dr. Anwar has done this.
Yes, he done this.
Yes. Then to find out the cause, is there any physical examination for this case?
No, there is no.
Yes, doctor. Yes, it has to be identified from the history. The cause is osteoporosis, and it has to be identified. The diagnosis is osteoporosis. The cause is flutamide. So it has to be identified from the history. Then let's come to the complication. What will be the complication?
So the vertebral complication, there could be nerve root damage. So
yes.
So nerve root damage, and
what will be the can be the complication for any low back pain overall? I'm helping you, doctor. So any low back pain, there are two complications in common. One is weakness at the lower limb. So Dr. Anwar has had to examine the lower limb. If time does not allow, at least check the plantar to exclude the cord compression. And also for low back pain, Dr. Anwar has to offer for checking the gait. And he has missed to check it. Are you getting it, doctor?
Yeah.
So in the physical examination, mistakenly he did not check the gait and also did not examine the lower limb. Are you getting it?
Yes.
Then come to the association. Is there anything in association for this prompt?
No, there is no association.
Yes, there is no association. So based on this, how will you like to provide mark to Dr. Anwar? Will it be satisfactory? Will it be borderline? Or will it be unsatisfactory? Please give your valuable judgment.
It will be borderline.
Exactly, doctor. It will be borderline. And in the mark sheet, it will be given like this. So in this way, you have to practice within yourself. Okay. It was the physical examination. Now let's proceed to the next skill. Regarding the identifying physical sign, how will you evaluate Dr. Anwar?
As there is no such physical signs,
only one thing was that.
That was
tenderness.
Tenderness. He checked that. So
yes, doctor.
So it should be satisfactory.
Exactly, doctor. It will be satisfactory. Now let's come to the clinical communication. Yes, doctor.
Yeah, doctor, I wanted to ask one question. So basically, this will be a dummy case, right, in exam?
Yes, doctor. You have got to the point. It will be dummy case.
So can we say that patient has tenderness?
Patient will tell you that I am feeling pain. He will be instructed that whenever the candidate asks you, do you have any pain? The patient have to tell that I am having pain.
Yeah, what happened, doctor? I had a case of suspected amoebicular abscess in Pune center. And I knew that this candidate is a dummy. And but he was complaining of tenderness in his right hypochondriac region. And I told in examination that patient has tenderness in right hypochondriac region. I even told them, should I palpate or not palpate? They said, you do whatever you want to. And actually, they gave me unsatisfactory. And mentioned that patient doctor elicited tenderness in right hypochondriac region, which was not present. Yeah,
Oh
so
my
that's
God.
why I'm saying, yeah.
So it was a mistake from the surrogate then. He was telling that he was having pain, but
Yeah, he was telling clearly that he has pain. I
that
asked them,
is
should I examine or not? And they have mentioned that doctor found tenderness on examination.
so the surrogate gave you the information that he is having pain, but the
Yeah.
examiner did not hear this. It is completely
Yeah,
their mistake, doctor, and this is
yeah,
completely
yeah.
unlucky.
Yeah, they gave me unsatisfactory in examination. Yeah.
Yes, doctor. Actually, these kind of things sometimes happen with particular centers. There is a particular pattern for such. Pune is one of the center. This thing happens at Pune, and sometimes it happens with the Thiru also. So
Yeah.
forget about this. Actually, it is completely unlucky because the patient has given you one information and the examiner is hearing something else. So that is completely unfortunate, doctor.
No, even they were knowing that this is a dummy case. And no, in front of them only, I told them that patient is saying pain here. So should I go ahead or not?
So you can make a mail to the RCP.
No, this was
That,
long back, actually, 1 year back. Now I have forgotten it.
oh,
Yeah. Yeah.
actually, doctor, this is unfortunate, truly speaking. Okay, let's come back again. So, Dr. Sabir, regarding the clinical communication skill, it will depend on how Dr. Anwar has taken the history, whether he has taken important history, whether he has done important safety meeting. It will depend on that. So, based on this, how would you like to keep the mark to Dr. Anwar?
Uh, he asked the all important questions, and I think he take the uh, history in a satisfactory manner.
Yeah, it will be satisfactory, but I'll be a little bit judgmental here because most of the cases it will be satisfactory. Most of the examiner will be liberal. Sometimes there will be some examiner, like Dr. Has already mentioned in the Pune, there will be some critical. Like the patient was telling, I'm feeling pain, and the pain was 6 out of 10. So my job right now at that point is to offer painkiller. That we have to tell the patient at the end of our discussion, I will offer you some painkiller. Will that be okay with you? Because we have to settle the patient. Are you getting it, doctor?
Okay. Yes, I'm getting it.
So we have to offer the painkiller. You have to keep it in mind. Then another thing is, Dr. Anwar has taken history for mechanical back pain. Also, he is also taking history for inflammatory back pain. If we go back to our previous class, okay, let me open the file.
Yes, the patient said he has no morning jamming, but he
Yes,
said ask all the rheumatological question.
yes. Actually, no mark will be cut for asking this question, but better to avoid. Okay, where is this? Sorry, let me find it. Yeah, this is there. So why I'm showing this? Whenever from the history, it is clearly seeing that it is a mechanical cause. So we can skip this part. We can skip that. Is the patient is having any rash? Is the patient having any skin tightening that is found in case of rheumatological disease, that is rheumatoid arthritis or ACL or something like that? And Dr. Anwar has spent a lot of time asking these sets of questions, which is not necessary. Are you getting it, Dr. Anwar?
Yes, sir.
And for this, actually, no mark will be cut, but it is unnecessary. So based on this, actually, no mark will be cut. Yeah. Another thing, please tell, doctor.
Another thing, I'm not sure if he asked about body temperature during his history taking, but
No,
later when
I didn't notice.
uh,
It,
but later when he said that differentials, he said the patient has no fevers to exclude the septic arthritis.
yes,
So
doctor. Actually, doctor has passed some unnecessary time in taking history in this part. So better to rule out this thing. That do you have any injury? He has asked this. Any high temperature? Then any past medical history? He has also asked. For multiple myeloma, we can ask the symptoms of hypercalcemia, but 3 days pain will not come as multiple myeloma. Then another thing is there. Dr. Anwar started with closed question. Did you notice it, doctor?
Closed question, meaning?
He told me that from your file, I have come to know that you have problem with low back pain. Can you tell me more about it? So what
Yes,
happened?
it was in the introduction part. He should have said, in your own word, can you describe your symptoms?
Yes, doctor. It is better to ask open question, because what happens, most of the cases, the surrogate are very much helpful. So whenever you ask a question, the surrogate may intentionally give you some more information, which will help you in get your diagnosis. But if you ask some close question, you will become confined to that symptom only. Are you getting it?
Yes, I'm getting it.
Also, for this, no mark will be cut, but better to avoid close question. So based on this, how will you give the mark to Dr. Anwar in clinical communication skill?
I will score him satisfactory.
Okay, that's fine. Then regarding the differential diagnosis, what will be your judgment?
In case of differential, he told all the important differentials.
Yes, doctor. So he told. So what will be there? So
Yes, it will be satisfactory.
Satisfactory. Then clinical judgment. Did he told all the investigation and management? Did he notice it?
Yes, he's told all the investigation.
So what will be his performance in this case?
It will be also satisfactory.
Yes, doctor. Then managing patient consent is satisfactory, and welfare is also satisfactory. Regarding welfare, let me tell you one thing. Start doing hand washing, and after completing the examination, tell the patient thank you, if possible 3 times. Thank you very much. Thank you very much. You have done wonderful job for me. Show it to the examiner that you are giving thank you to the patient. And after completion of the examination, help the patient to put on the gown again. Whenever you are trying to help the patient to put on the gown, instantly the surrogate will come will help you. But show this gesture to the examiner to prove that you are very much empathetic and you are careful about the patient. So based on this, for satisfactory, it will be 2. For borderline, it will be 1. For this 7 skill, what will be the total mark for each examiner out of 14? Dr. Sabbir?
Then 11. 11. 13. It will be 13.
13. It will be 13. So from one examiner, it will be 13 out of 14. If we multiply into 2, it will be 26 out of 28, because it will be just by 2 examiner. So Dr. Anwar has got 26 out of 28. Are you getting it, Dr. Anwar?
Yes, sir. I'm getting it. And I think the marking is liberal, sir.
Yeah, the marking is liberal. It depends on the examiner. I'm showing it because you have to practice within yourself in this way. And believe me, if you practice in this way, after 5 to 6 sessions, you will become a pro. Now, what will I do? I will give one case to Dr. Sabbir, and Dr. Anwar will be the examiner right now. So it's time to take the revenge. So any question from this prompt, Dr. Anwar?
No, sir. Yeah, thanks so much.
Okay. So let me pick up the case for Dr. Sabbir right now. So, Dr. Sabbir, this is your case. And this time, Dr. Anwar, you have to be careful to the performance of Dr. Sabbir. Please try to take note what improvement Dr. Sabbir has to done for each skill. Are you seeing the screen, Dr. Sabbir?
Yes, I'm seeing this.
Okay, you have 2 minutes time to take the preparation. After 9 minutes, I will give you a warning that you have 2 minutes left.
Okay.
Are you ready, Dr. Sabbir?
Yes, I'm ready.
So let's start. Start.
Uh, Hello, sir. I'm Dr. Sabir. Today, I am one of the passage examinee here. I've been asked to talk to you about your complaints and do some investigations. During our session, I will take some notes and ask you some questions. But rest assured, everything will be confidential. Are you okay with this, sir?
Yes, doctor.
Can I ask for your identity?
Doctor, I'm Mr. Jackson. I'm 45 years old.
Okay, Mr. Jackson. In your own word, can you describe me what brings you here today?
Doctor, I'm having some hand pain for the last 1 month, doctor. I'm very much bothered about it. Please help me, doctor.
I'm sorry to hear that. Is it the first time or it happens before?
This happened for the first time, doctor.
Can you tell me how it starts? Is it starts suddenly or gradually?
It started gradually, doctor.
Okay. How can you describe your pain? Is it getting worse day by day or is it same as before?
It is, I think, getting worse, doctor.
Getting worse. Anything worsen the pain? Any activities?
No, doctor. Activity relieves my pain.
Okay. So activity relieves your pain. Any other do you have to take any medications or anything for the pain?
Right now, I'm not taking any medication for my pain, doctor.
So is the pain just in your hand or any part of other part of your body too?
The pain is at my joints, doctor. The joints of my hand.
Hand. Um, so can you show me which joints of your joints are you feeling pain? Hello, hello.
পেশেন্ট আসছে
Hello.
Hello, am I audible?
Hello. Yes.
I'm extremely sorry. My Wi-Fi connection suddenly got abrupt, just disconnected. I'm extremely sorry for that. So
Okay.
I was pausing the time. Let me start the screen sharing again. So please continue, doctor.
Okay. So I was asking, in which part of your hand is you feeling pain?
Yeah, I'm feeling pain at the joint.
Joint. Okay.
Yeah.
In a scale of 1 to 10, how will you score your pain?
Doctor, it is 4 out of 10, doctor.
4 out of 10. How will you describe your pain? Is it dull, sharp, or
It is something like jamming type of pain. My joints gets jammed.
gets jammed? Do you feel a morning jamming?
Yes, doctor, I have morning jamming.
Can you tell me how much time usually the jamming persist?
Actually, doctor, after 40 to 50 minutes, doctor.
40 to 50 minutes. Uh, do you ever feel that your joints get color change during cold exposure?
No, doctor.
And- Okay. Uh, so, do you have any change in your nails?
Yes, doctor, I am having some change. You're seeing the screen.
Okay. Do you think your skin gets thickened?
No, doctor.
Okay. Uh, so,
Hello.
hello. Yeah. And
Yeah,
do you
please continue.
do you have any vision problem?
No, doctor, I don't have any vision problem.
Do you apart from your joint pain, do you have any raised body temperature?
No, doctor, I don't have that.
Okay. Do you have any difficulty in breathing or cough
No, doctor.
or chest pain?
No, doctor.
So, do you have any past medical condition I should aware of?
No, doctor, I didn't have any past medical condition.
Do you have ever any surgery or any hospital admitted,
No,
anything
doctor.
that needed hospitals? Do you currently taking any medicine?
Right now, I'm not taking any kind of medicine, doctor.
Do you have any known allergy to any known medication?
No, doctor. I don't
Does you
have any allergy.
does any of your family member having same kind of problem?
No, doctor, not same kind of problem. No other family member having the same kind of problem, doctor. My mother is having some joint problem. She was diagnosed with rheumatoid arthritis. And my father had some also joint problem. It was told ankylosing spondylitis, doctor.
Okay. So they are well right now?
Actually, doctor, my father died of heart attack.
I'm sorry to hear that. So I'm asking some other question. Do you have any? Do you ever notice any skin rash?
Yes, doctor. I noticed some rash at my elbow, doctor.
Okay. Do you ever notice hair fall?
No, doctor.
Do you ever do you think what about your weight? Do you have any weight loss
No,
or
doctor.
weight gain?
No,
How
doctor.
about you? How about your back passages?
Normal, doctor.
How about your waterworks?
It is also normal.
So now I will ask you some personal question. Do you have a partner?
Yes, doctor. I have my wife.
Okay. I again sorry to ask you, do you have any casual relationship?
No, doctor.
Uh, do you smoke?
Yes, doctor. I do smoke.
How much can I ask?
About 10 to 14 cigarettes per day.
For how many years?
For the last, doctor, 10 years.
So as you know, smoking is injurious to health. So I would like to refer you to smoking cessation clinic. Is it okay with you?
Okay, doctor. I shall give it a try.
Okay. Do you drink alcohol?
Yes, doctor. Sometimes at the weekend with the friends and party, I drink alcohol.
Is it within social limit?
Yes, doctor. It is within social limit.
What do you do for a job?
Doctor, I'm a plumber.
Plumber. Does your joint pain have any impact on your job?
Actually, doctor, it is getting some problem. Actually, working improved my pain, but I'm feeling some problem with working due to this pain.
Okay, so I'm sorry to hear that. So I'm going to refer you to the occupational health worker. So do you drive?
Yes, doctor, I drive.
So now I'm going to examine you. Is it okay with
Okay.
you?
Yes, doctor.
So first examination, I want to start with your hand examination. So I will ask for
Okay.
a pillow and I will
Okay, pillow is
request you
given.
to. So first, I am going to show the nail. There is some pitting. I'm seeing there is some pitting.
How to check for the pitting? Doctor, how to check for the pitting of nail?
Sorry, I don't know that.
It was described in the video, physical examination video. You have to feel for the nail pitting.
Okay.
Then
So
proceed.
first, is there any rash on the hand? I'm
No.
seeing there is no hash. So there is no skin. Can you pinch your skin for me?
Yes, there is no skin thickening. Why do you want to check the
Okay.
rash?
I want to check the rash on the extensor surface of the hand. I
Like?
have the forearm, hand, forearm, and then
There is rash at the
the
right forearm.
elbow,
There
right
is
forearm,
rash
and
at the right elbow. Then?
elbow. And then I will check the rash below, behind the ear, pinna,
Okay.
and
Noted. Then?
I will ask permission to check if there is any rash beside the nipple area, and
Okay. Then?
beside umbilicus, and then at
Then?
the private part. I will ask
Private
permission
parts
to
means
check
which area,
uh,
doctor?
in the in the buttock, in the
Then
buttock,
anything else?
and and the area behind the scrotum also.
Okay, 2 minutes left, doctor.
Then I will examine the face for any rash or anemia or jaundice.
Absent.
And
Absent.
and then I will examine the hand for any muscle weakness, or and I will ask for the functional capacity, like if he can do fisting and unfisting, and buttoning and unbuttoning.
He can do it.
Then I will check the eye for any reddening, and I will ask for if there is any feature of fibrosis in the lung, and if there is any.
How to check it?
If there's, I will auscultate the lungs and here for any inspiratory caggles, especially in the apical area. Apical area.
Absent.
Absent. Then I will auscultate for any murmur for the aortic regurgitation while sitting for, and then I will check for if there is any Achilles tendinitis, and I will conclude my examination after checking the edema, leg edema.
Okay, absent.
So, Mr. Jackson, what is your concern?
Doctor, why I'm having this hand pain?
So, Mr. Jackson, after taking your history and examining you, I think you have a condition. Don't bother the medical term. I think you have a condition which we call psoriatic arthritis. Actually, it is a condition where our body immunity system affected our joint and do some damage in our joints. So you are feeling pain. But we will do some investigation. We will by examining your skin scraping from the rash and your nail, and we will do some scan. And after confirming the diagnosis, we will form a multidisciplinary team involving the joint doctors and physiotherapist and specialist nurse.
Doctor, stop, pause. Don't tell at such long line, because there will be many other concerns left. So just tell in this short sentence. So the next concern is it curable, doctor?
I'm sorry to say that it is not curable condition, but with proper treatment and we can manage this condition.
Okay, time's up, doctor. Actually, you have taken a more time then. Okay, no problem. It will become automatically okay after passing of some time. So, so doctor, do you have any diagnosis or differential diagnosis?
So I have some differential diagnosis.
Okay.
What is my first diagnosis is Mr. Jackson has psoriatic arthritis, and my other differential diagnosis is it could be a rheumatic arthritis or other seronegative arthritis.
Okay. So, what are the positive physical findings, doctor?
Positive physical findings is the patient has change in his nail, and there is a psoriatic rash in his forearm and elbow, and there is positive morning stiffness, and apart from that, there is pain in his tenderness in his interphalangeal joints.
Did you check it? Did you examine the
No.
joint?
No, I didn't examine the joint.
Yes, doctor. That's why you have missed an important physical finding, and that will be counted. Okay, let me tell you in later. Then, did you
apart
examine the
from
knee
that,
joint?
no, I didn't examine the knee joint also.
Why it is important?
Rash.
Yes, because
that
typically in the exam,
eh,
yeah, it will be covered by gown, and it happened at
yes.
the Delhi center. It was intentionally hidden by under the gown. So you have to elevate the gown, and you have to check at the knee joint. If you miss the rash, you lose your mark, and there was a rash here.
Okay.
Okay. How would you like to investigate for this gentleman?
So investigate to confirm the diagnosis. I will do I will take the skin stepping and
Doctor, tell professionally.
biopsy. Okay.
No. What will be the initial thing for every investigation?
So we'll do the X-ray of the joint, and
No.
apart from the basic investigation, I will
Yes,
do
doctor.
I will do CBC, CRP, ESR, and
That is the basic investigation.
rheumatoid factor.
Yeah. Yes.
Rheumatoid factor. I will examine the rheumatoid factor, and then I will do the skin biopsy, and I will do the joint X-ray of the joints, and to exclude the other condition, I will exclude the complication. To diagnose the complication, I will do X-ray chest, HSCT, and eye split lamp examination of the eye and echocardiogram.
Okay. Also tell the examiner that on the X-ray and HSCT, I want to rule out apical fibrosis. In the slit lamp, I want to rule out anterior uveitis. In the echocardiogram, I want to rule out aortic regurgitation. Just tell in this way.
Okay.
So, what will be your management, doctor?
So my management will be in general management. I will educate the patient about the condition and counsel and form a multidisciplinary team involving the rheumatologist and physiotherapist. And specific therapy will be according to underlying cause.
Yes, then pause. Treatment of the underlying cause, then pause. Then the examiner will ask you the question. Suppose the underlying cause is psoriatic arthritis. What will be your treatment?
Psoriatic arthritis, the treatment would be first NSAIDs and disease modifying drugs like methotrexate.
Okay, doctor, let me add you one thing. NSAID is contraindicated in psoriasis because it is one of the exacerbating factor of psoriasis. That's why in psoriatic arthritis, we cannot offer NSAID. We can offer pain medication in the form of paracetamol and if needed, some opiate analgesic, but never NSAID.
Okay.
The treatment will be methotrexate, doctor.
Yes.
Okay. Now let me start. First, let me check my Wi-Fi. Okay. So, Dr. Anwar, are you there?
Yes, sir.
So, I hope you have heard about his performance. So, this was a case of hand pain. Due to the diagnosis was psoriatic arthritis. I'm extremely sorry. Today, my Wi-Fi and also my iPad is doing some problem. That's why the connection is frequently losing. So, Dr. Anwar, regarding the physical examination, how would you like to evaluate the performance of Dr. Sabir?
Sir, I would give borderline.
Why? Please tell me.
Yeah, just as you told, he missed some examination points like examination of the
Like?
knee, rash, examination of the knee joint and the rash, and the local examination. He didn't check for the
Yes.
the interphalangeal joints for
Yes, doctor.
yeah.
So for Dr. Sabdil and all the others, can you make a form in the form of CCCA for this case? Like what examination we have to do for confirming the diagnosis, then to find out the cause, then to find out the complication, and last association. Dr. Anwar?
Yes. So for the confirmation of the diagnosis,
Yes.
he did this thing. I mean,
He has to
couldn't
examine the joint.
joint, so he didn't elicit the tenderness.
Yes. In
So
short,
that was the thing.
he has to examine the joint.
Right. He
So,
didn't examine.
yeah, so he missed it.
Yeah.
Then to find out the cause, what examination he has to do?
He did find the nail changes, and
Yeah,
that thing. And the rash,
but
he also found the rash in the elbow and
but he missed the rash in the knee
rash on the
joint.
knee. Right. Yeah.
So also mark would be carved at this point.
Okay.
Are you getting it?
Yes.
Then for the complication, what will be?
Complications. Complications. He did mostly all the things like anterior uveitis, apical
Yes.
fibrosis, the
Can you
CVS
remember
exam.
the mnemonic?
Yes, sir. That this 5 A's.
Yes. Please tell it once again.
Yeah, sir. First A is for anterior uveitis. The second A is
Yes.
for apical fibrosis. The
Yes.
third A is for aortic regurgitation.
Yes.
The
Wonderful.
fourth is for
Then
amyloidosis. So you check for hepatosplenomegaly in the abdomen. And fifth,
it can be omitted. No,
okay.
don't worry. Then
And
last day.
Achilles tendonitis.
Yes. So he has done for that.
Right.
So we can. This is a tick mark. It has been done.
Yeah.
Sorry.
Bhaiya,
I think.
sorry to interrupt. I have a question. If
Yes.
he complains of heel pain, should I go check for Achilles tendinitis, or this will hamper my welfare?
We have to ask, do you have any pain? If the patient complains of pain, we have to take permission from the examiner that should I proceed for the examination. Even after that, the examiner tells you that you proceed with gentle approach. Then we have to be careful and elicit some pain. Are you getting it, Dr. Kia?
Yes, ma'am. So I should ask for permission.
Yes, we have to ask for permission. And sometimes unfortunate things can happen, like Dr. Gmail.
Yes, yes. Same thing happened to me with in Hyderabad also. So they told me, what you do, whatever you do, and this was a trap. So later on, they cut
Yes,
marks in the physical examination. Yes.
that is thing. Whenever but one thing happened at the Pondicherry, the patient was feeling pain at the tummy. It was a case of ADPKD. Patient was feeling pain, and the candidate asked from the examiner, should I proceed? The examiner replied that proceed with gentle approach. But the candidate who was in fear that he will lose mark in the physical exam due to eliciting of PR, he did not examine the tummy, and he lost mark in the identifying positive physical finding. So it will actually depend on the examiner. Forget about that. This is unfortunate. So let us come back. So Dr. Anwar, there was a small mistake. Dr. Anwar, are you getting it?
Yes, sir.
Actually, to find out the complication, the prompt was hand pain. So what will be the complication?
Okay. Hand pain complication.
Limitation of the functional capacity of hand.
Right.
Yeah. So
Yes,
it will be the complication.
Right.
Yes,
Okay. And those associations, right? Okay.
Yes, doctor. I also made the mistake that it will become the complication. In
Right,
the
okay.
association, we have to put other thing like that 5A.
Yes.
Are you getting it?
Yes, sir.
So
yes.
based on this, how will you give mark to Dr. Sabir?
Yeah, he asked the patient to make a fist and the button unbuttoning, and he asked that. So he
Yes,
did
doctor. He checked for complication, and he also checked the association. But
Right,
he did not examine the joint. He did not confirm the diagnosis, and he missed to find out the cause. That is, he identified the nail change and also the rash at the elbow, but missed the knee joint rash. And believe me, in the exam, Sometimes the examiner are very much sensitive. They want to know whether you are identifying the knee rash or not. If you don't identify that, or if you don't examine for the knee rash, they will give unsatisfactory. This thing happens very frequently with Delhi and Pondicherry. They are very much sensitive. They know either satisfactory or unsatisfactory. They don't know the borderline.
Okay, sir.
Okay, based on this.
I'm sorry, sir. Can you please repeat what you said?
Actually, with Delhi and Pondicherry, these are wonderful centers. So what I have noticed that they avoid giving borderline. They whatever is written in their prompt, like in the Delhi, there is some knee rash, and if the examiner did not examine for the knee rash, they directly give it as an unsatisfactory. What about the other findings? What are the other examinations that candidate has done? And if they examine the knee rash, he will directly go to the satisfactory. So mid zone is avoided. It happens to some center. Have you got it, doctor?
Okay, sir.
So based on this during practice, I will suggest to become more criticized. It will help you to improve, because it is not that like that he has done well and I will. It will not help in the long run. So Dr. Anwar, based on this, how will you keep the criticism?
Yeah, I would. Yes, sir. I would give borderline.
You will give borderline. Okay, doctor, don't worry. But if I was there, I will give unsatisfactory.
Yes.
Okay, then identifying physical sign. What will be the what
sir,
will be judgment?
yeah. So for the as he did partially did the identification of the rash, it was linked. So it will also
He missed
go
the
for
knee rash, and also
yeah,
he missed the tenderness of the hand.
tenderness of the hand. Yeah, he missed that.
So based on this, what will be your judgment?
So he missed the important point.
Yeah. So what will be judgment?
Unsatisfactory.
Yeah. Doctor, please try to criticize as much as you can, because it will help him in the long run.
Okay,
Believe me, if this same case comes in his exam, he will become perfect. This is to help him, not to make him champion.
Yes.
Then clinical communication skill. What will be?
Clinical communication, I would give him borderline because
Why,
his the approach and it was the haphazard. It was not organized.
Yes,
He was asking.
it was not organized.
Yeah.
So if we approach, the first question will be, what do you mean by hand pain exactly? If we go back to the previous class, it will be, what do you mean by hand pain exactly? Is it joint pain, color change, tingling and numbness, or pain? Sometimes the surrogate will intentionally hide the hand pain. So in this case, I have told him that I'm having joint pain. But if the surrogate is not that much helpful, he will hide it to whatever it extends. And we have to take preparation for the worst condition. That is why I will suggest Dr. Sabir to go through the previous lecture and go through this approach. Because unless you ask this thing, it happens that sometimes the surrogate will not give you the right information. Maximum time it will not happen. But be prepared for the worst situation, doctor. Are you getting it, Dr. Sabir?
Yes, yeah, I get it.
So based on this, Dr. Anwar is giving borderline.
The other thing is that he started, he asked permission for and he identified the patient afterwards. So that was jumbling. So you should have first asked the identification and then he goes for the permission.
Yeah, it is well. So actually, during starting of practice, this kind of mistake happens with many candidates. I have personally seen with many candidates. And what I have seen that after 6 or 7 sessions, they become a pro. And they pass the exam with high score. Like one candidate had got 160 out of 168. And initially he was very much mumbled. This is some real example I have experienced.
Yeah, right, sir, right.
So this is just a matter of practice. Okay.
Right, sir.
Regarding the differential diagnosis, what will be your judgment?
Differentials. Just wait, sir. He gave psoriatic arthritis and rheumatoid arthritis also. So
yes,
it was okay. I mean, it was satisfactory.
Yes, it is satisfactory. Then clinical judgment?
Clinical judgment. Clinical judgment, sir, I would give him unsatisfactory because, as you told, NSAIDs are contraindicated in psoriatic arthritis, and so he prescribed those.
Yes. Yes, doctor. Please be judgmental. And also during meeting concern, he told that immunity. Immunity is a jargon. Instead of immunity, what thing we can use for meeting the concern?
Defense system.
Yes, doctor, defense system. So how will you give the mark in the managing patient concern?
Yeah, would be borderline.
Yes, doctor, borderline. Then patient welfare will be, I think it will be satisfactory. And during examination of the hand, we have to offer a pillow. And
Yes.
Dr. Sabir has offered that.
No, he offered that, right?
Yes, he offered it. One time, candidates have asked this question in the comment section. That's why I have told this. So based on this, what will be the total mark from each examiner out of 14?
Would be 7. 7 plus 7.
Okay.
14 out
Yeah.
of 20.
It will be 14 out of 28. So this is his mark for this today. So Dr. Sapi, do you have any confusion?
No, I don't have any confusion.
So right now, what will be your job that Dr. Anwar and Dr. Sabir has to practice each day with each other? And I am providing you the PDF sheet. With the PDF sheet, you can add some information or you can extract some information, but you have to do practice with each other every day using this mark sheet for the next session. Is it clear, doctor?
Yes, sir. Okay.
Okay.
Okay, sir.
Is it okay, Dr. Sabir?
Yes, okay. It's okay.
Oh, okay. That's all. Now let me go to the next pair. So let me see who is there. So Dr. Raisa, are you there?
Yes, I'm here.
And Dr. Partho, are you there?
Yes, brother.
So right now I will give a case to Dr. Raisa and you have to keep the judgment.
Bhaiya, actually, me and Raisa, we want to practice together. Is it possible or?
Yeah, is it possible? But in your everyone has to practice with each other. That's why I just shuffle. Today I'm making
Okay,
practice with
that's
Dr.
it.
Partho
Okay,
and
fine.
Dr. Raisa. Next session it will be shuffle, and you have to practice with each candidate. Okay, so this is your case, Dr. Raisa. Are you seeing the screen?
Yes, I can see.
Okay, you have 2 minutes time. This was exactly my case at Pondicherry. So, doctor, are you ready?
Yes, doctor.
Okay, start.
Hello, I'm Dr. Angona, one of the doctor in this clinic today. Am I talking to Mr. Jackson, 30 years old?
Yes, doctor, I'm Mr. Jackson. I'm 30 years old.
Okay, so today I'm here to talk regarding your health condition, at the same time to examine you. Is that all right?
Sure, doctor.
Okay, so from your notes, I can see that you have some low back pain. So can you tell me that is it the first time you're having this low back pain?
Yes, doctor, this is the first time.
Okay, and how it started? Suddenly or gradually?
It started gradually, doctor.
Okay, so for how long you're having this back pain?
I'm having this for the last 3 months.
For last 3 months. So is it increasing or decreasing or the same intensity?
Doctor, I think it is increasing, doctor.
Okay. So do you have any, did you notice that it is increased at the morning or any time?
It is
Any
more at
time
the
of-
morning, doctor.
Okay. So in these 3 months, is it progressing?
Yes, doctor, I have told you that it is gradually increasing, I think.
Okay. And okay. So can you tell me that what is the character of this pain? Is it dull or sharp?
It is dull pain, doctor.
Dull pain. Okay. And can you please grade the pain for me? 0 being the minimum and 10 being the maximum.
It is 5 out of 10, doctor.
5 out of 10. Okay. So do you have any pain right now?
Yes, doctor, I have pain also right now.
Okay. So I will offer you some painkiller at the end of our conversation. Is that all
will be
right?
very nice, doctor. Thank you, doctor.
Okay. Okay. And do you notice any, does this pains go to anywhere else?
No, doctor.
Okay. And okay, so do you have apart from this back pain, do you have any pain anywhere else?
No, doctor.
Any neck pain?
No, doctor. I don't have any
Any
neck pain.
Okay.
Yes.
And any pain in the back of your leg part?
No, doctor.
Okay. So do you have any nighttime pain?
Yes, sometimes the pain is so severe that it becomes worse after taking rest. So sometimes I have to rise from the bed due to the pain.
Okay. So do you feel morning jamming?
Yes, doctor, I have morning jamming.
Okay. And is it relieved after activity?
Yes, doctor.
Or-
It relieves after activity, doctor.
For how long you have this morning jamming?
So it stays there for about 40 minutes, doctor.
40 minutes. And how it is improved?
After doing some activity like movement and doing some exercise, I feel better.
Okay. So do you have any recent history of injury?
No, doctor.
Okay. And any loss of control of your bowel or bladder work?
No, doctor.
Okay. And any loss of sensation around your private parts? I am sorry to ask.
No, doctor.
Okay. So okay. So do you have any redness in your eye?
I didn't notice.
Any eye problem or any vision problem?
No, doctor.
Okay. And okay. Do you have any rash anywhere?
No, doctor. I didn't notice any rash.
Okay. So do you have any chest pain?
No, doctor.
Any racing, pacing of your heart?
No, doctor.
Any cough?
No, doctor.
Any shortness of breath?
No, doctor.
Okay. And do you have any tummy pain?
No, doctor.
Any tummy distension?
No, doctor.
Okay. How is your water work in amount, color, and frequency?
It is normal, doctor.
Okay. How is your bowel work?
It is also normal.
Did you notice any loose stool or hard stool?
No, doctor.
And did you notice any time any blood in your stool?
No, doctor.
Okay. Okay, so do you have any past medical condition that I should be aware of?
I did not have any insignificant past medical condition, doctor.
Okay. Any raised blood sugar, raised blood pressure?
No, doctor.
Okay. And do you have? Are you taking any medication right now?
No, doctor. Right now, I'm not taking any kind of medication.
Okay. And any recent start or stoppage of any medication?
No, doctor.
Any over-the-counter medication?
No, doctor.
Okay. And any allergy to any medication you have?
No, doctor.
Okay. Do you have any significant family history of similar condition?
My mother used to have some joint problem called rheumatoid arthritis.
Okay. I'm so sorry to hear that. How is she doing now?
She's doing well with the medication, doctor.
Okay. So, may I know that I want to ask you some personal question. Do you smoke?
Yes, doctor, I do smoke.
And how many cigarettes for how long?
About 10 to 12 cigarettes per day for the last 10 years.
Okay. So, smoking is very injurious to health. So, I want to suggest you to quit smoking if possible. And if you want, I can refer you to the smoking cessation clinic. Is that all right?
Okay, doctor, I shall give it a try.
Okay. And do you take alcohol?
Yes, doctor, occasionally at the weekend.
Okay. Is it within the social limit?
Yes, doctor, it is within social limit.
Okay. And what are you doing for a living?
Doctor, I work at a local super shop.
Okay. And is this symptoms affecting you?
Yes, doctor, it is affecting my daily activity and also my job.
Okay. So I will refer you to the occupational health worker to help you regarding this. And do drive.
Yes, doctor, I do drive.
Okay. And I want to ask you that did you recently travel to anywhere?
No, doctor.
Okay. So do you have, sorry to ask, do you have any long-term partner?
Yes, I have my wife.
Okay. Apart from this, any other casual contact
No,
recently?
doctor.
Okay. Any discharge from private parts?
No, doctor. Yes,
Okay.
good.
Okay. And okay. So I want to examine you.
Okay, what do you want to see?
Okay, at first, as the patient is having back pain, I want to start from lower back.
Okay, at the lower back, what do you want to see?
First, I'll look for any redness or
Absent.
anything absent. Okay, then I'll palpate if there is any tenderness present or not.
Absent.
Okay, and then I want to do the movement in or 4 planes of the
Okay,
lower
there
back.
is restricted movement in forward plane, also in the
Forward.
backward. Yeah.
Okay. Okay, now I want to start from hands. In the hands, is there any nail changes?
Absent.
Any deformity in hand?
Absent.
Okay, and then I'd like to check for the pulse.
Normal.
And I
Rhythm
would like
normal.
to.
Volume normal.
Okay, I have to check for collapsing pulse also.
Absent. Very good.
Okay. And now I want to check for the. I want to know the blood pressure of this patient.
Same as given outside, it is normal. 120/80.
Okay. Now I want to check for if there any rash present over the knuckle or elbow.
Absent.
Okay. Is there any rash beneath the ear or hairline?
Absent. Absent.
Okay. In the face, I would like to check the eyes for any redness present or not.
Absent.
Okay. And inside the mouth, any finding present or not? Check.
Absent.
Okay. Now, in the neck, I would like to do again the movement of the neck. I would like to check.
At which plane?
Uh,
How to check
at
the
all
4 or
four
6
planes.
plane?
Forward, backward.
Okay, it is restricted.
6 plane.
6 plane.
Okay.
It is restricted.
Okay. Okay. After that, I would like to.
2 minutes left.
Okay, I'd like to auscultate the lungs for any murmur present or not.
Lungs for murmur or heart for murmur?
Heart.
Absent.
Okay, I'll check to auscultate the lungs for any in the apical region.
Absent. No fibrosis there. No crepitation
of the abdomen. Any finding?
Absent.
Okay, I'd like to check the Achilles tendinosus area. Any tenderness?
Absent.
And leg edema.
Absent.
Okay, and I want to offer the private part check and also the sole. I will check for any rash or present or not.
Okay, noted. It is absent.
And I have to do the to complete my examination. I'd like to do the modified Schobert test and occiput wall test.
You have to do this in the PCS exam, and I had to do this. So okay, in the Schobert test there is restriction movement. Do you know how to do this Schobert test?
Yes.
Okay, you have to do this in the exam, and there is increased occiput to wall distance. So,
okay.
Anything else?
And in the lower limb, I'll just check the plantar.
Normal.
Okay. So may I know that what is your concern for me?
Doctor, why I'm having this back pain, doctor?
Okay, so after talking to you and examining you, you have a condition which what I'm thinking it is named as ankylosing spondylitis. Don't bother about the medical term. It is a condition in which it affects the back of your spine, which is causing this pain and this morning jamming. And so what I'm going to do is I'm going to
just pause, doctor. Don't tell what you have to do. Meet the concern, because sometimes there are 6 or 7 concerns can be there. So he has asked you that what problem I'm having. You have told that this is something like this. Then ask for second concern, doctor.
Okay. So do you have any other concern for me?
Doctor, is it curable?
Okay, I'm very sorry to tell you that it is not a curable condition, but with treatment we can control this.
Okay, so what will you do now, doctor, for me?
Okay, so we will first do some scanning of the imaging of your back and some blood test to confirm your diagnosis, and then we will formulate a management plan for you, and we will give you now some painkiller as you are having pain, and we will follow you up.
Okay, doctor. So time's up. So doctor, do you have any diagnosis or differential diagnosis?
Okay, I have some differential diagnosis, and top of this I will keep ankylosing spondylitis.
Okay. Any other differential diagnosis?
Yes, it can be other seronegative arthritis, like psoriatic arthritis, but I couldn't appreciate any rash or any small joint.
Doctor.
And
very good.
it can.
This is the way to answer. Okay, continue, doctor. Then any other DD?
And it can be enteropathic arthritis. The patient, but the patient is not having any loose stool or any blood in the stool.
Wonderful, doctor. Very good. Anything else?
Yes, we can consider reactive arthritis, but the patient has no discharge from the private part or no recent casual contact or loose
Exactly,
motion.
Doctor. So I request every other active participant that this is the way to tell the differential diagnosis. Very good, doctor. So what are the positive physical findings you have got from this gentleman?
Okay. On examination, the patient is having restricted neck movement in all planes, and also restricted forward flexion of the back. And there is possible positive occiput wall test, and modified Schobert test is positive.
Yes.
Apart from that, the patient is having low back pain, and I couldn't appreciate any other positive finding.
Okay, doctor. Doctor, did you check the gait?
No, I forgot.
Okay, no problem. Whenever you are checking the gait, you'll find that he may have some stoop posture.
Okay.
Okay. So how would you like to investigate?
Okay. So apart from basic investigation like CBC, the CRP, I would like to first do the X-ray of the lumbosacral spine. And then I will do some blood test, including HLA-B27.
Okay. Anything else to rule out the complication?
Yes, to rule out the complication, I would like to do the chest X-ray, HRCT chest, and ECG and echocardiography. And
Also tell the doctor which complication. Also tell which complication you want to rule out.
for chest, I want to rule out the apical fibrosis, aortic regurgitation, and for amyloidosis rule out, I would do the ultrasonogram of the abdomen to see any organomegaly. And for if the patient is not complaining any eye redness, if there is present, then I will go for slit lamp examination.
Wonderful, doctor. That's all. That's then pause. Don't go for anything else. Then how will you like to manage?
At first, I will educate and counsel the patient about the condition, and then I will form a multidisciplinary team, which will include the rheumatologist and occupational health worker and social worker. And then I will first management of this for this pain. I will start some painkillers like NSAID.
Okay. Suppose if the patient is not responding to NSAID, then what will you do?
If not responding, then we can start the biologics.
Yeah, wonderful, doctor. Very good. So do you know any agents that is responsible for reactive arthritis?
Reactive arthritis?
Yeah.
Reactive arthritis?
What are the agents that is responsible? Like to take history of unusual discharge and into personal history in casual contact. Anything related to that?
I don't know surely actually. Maybe.
Okay. Chlamydia.
Oh, okay.
Actually, for this question, no mark will be cut. But this question was asked to me in the Pondicherry. Okay. Let us start analyzing your performance. So, Dr. Partho, are you there?
Yes.
So, let me, please help me to analyze Dr. Raisa. So, this was a case of low back pain. The diagnosis is ankylosing spondylitis. So, regarding physical examination, how would you like to evaluate Dr. Raisa's performance?
Physical examination was really good.
Yes.
She just forgot to take the gate.
Yes,
So that's
only
why
mistake was
leaving her borderline.
Okay, such a strict examiner. I want that kind of examiner. Okay. Yeah. Please tell me, doctor.
And then in the physical examination sign, and she forgot to elicit the sign of question mark posture. So there is also borderline.
Yeah. But the case that is present in the Pondicherry, that patient is not having any question mark posture. But be prepared to check for this. Then regarding the clinical communication skill?
I thought it was good.
Yes, it was wonderful. Only one thing was there. It will be satisfactory. But I will suggest that to better start with open question. Because Dr. Raisa asked about the closed question that from your note, I have come to know that you are having low back pain. So better to avoid this kind of question. Are you getting it, Dr. Raisa?
Yes.
Okay. Better to avoid asking closed question.
Also, another thing was she was. Yes. Also,
yes,
another
doctor?
thing was when she was asking about any causal contact. I think it will be wise if she starts like, "I'm sorry to ask you this personal question in casual contact."
I think she did it.
I say
She did it, doctor. She took permission for that.
Okay.
So for this, I think it will be satisfactory. Only avoiding closed question.
should I start like what problem brings you here today?
Yes, doctor. That is the ideal question.
Okay.
Then differential diagnosis.
So it was good. It was satisfactory.
Yes, magnificent. It was not good, it was magnificent. Then clinical judgment.
It was also good.
Yes. And concern.
Person was good. She made all the concern.
Yes. And maintaining welfare.
It was also good.
Yes. So during practice, try to tell thank you to the patient. It will become a reflex in the exam center. That thank you very much, doctor. Sir, you have done a wonderful job for me. And if possible, do some handshaking with the patient and try to help him putting his gown on. This will create some good impression to the examiner. So based on this, what will be the total mark out of 14 from each candidate? Dr. Partho?
It will be, I think, 12. Sorry, it will be, I think.
Yeah, you're right. It will be 12 from
12.
each examiner. So if we multiply 2, it will be 24 out of 28. So, Dr. Raisa, do you have any question from this?
No.
Have you noticed only for not checking the gate, you have lost mark in physical examination and identifying physical sign? Otherwise, your history taking was awesome. It is very much easy for you to get 28, and there are lots of examination for this case.
Yes, that was I thinking that at last I was running for modified Schobert test and is 2 minutes remaining. There are so many complications of AS actually.
Yes, doctor.
And that's okay.
And if this case comes, you have to do this examination. And as far as I remember, your exam center is Pondicherry.
Yes.
And at the Pondicherry, this case is there. I was given this case and I had to do the modified Schobert test with the marking there. I have to put on the marking, I have to measure the diameter. It has to be done.
Okay. Okay, and regarding the Schober and modified Schober, there was a difference. Like previously, it was done like 5 centimeter below and 10 centimeter above. So which one we should do now? Now it is modified
this
Schober.
one. I did 5 centimeter below and 10 centimeter above. I did that thing.
Okay, okay.
You can go with either. And one thing I tell you that there's tricks that I was the first person who started with this case. I was the first person. So I did the examination and I put a mark, and it was not erased from the patient's body. So the next candidate did not have to do the test. They just do some movement of the they just copied it. And after getting out from the exam center, they all told me that we were lucky that we got it already there. So you may be lucky sometime.
Okay.
Okay.
Thank you for the tips.
Okay, that's all. So right now, it is Dr. Partho's turn, and Dr. Raisa will be the examiner. So time to take revenge. So Dr. Partho, are you seeing the screen?
Yes. Yes.
This is your case. And Dr. Raisa has to analyze your performance. Are you ready, doctor?
We can start.
Sorry. Are you ready?
Yes, Bullet. We
Okay.
can start.
Let's start. Start, doctor.
Hello, good morning. I am Dr. Shakra of Dr. English. You must be Mr. Johnson, 40 years old.
Yes, doctor. I'm Mr. Johnson. I'm 40 years old.
Mr. Johnson, I'm here to talk to you and examine you regarding your health condition. Is that all right for you?
Okay, doctor.
During my consultation, I may take some notes. It will be highly confidential. Is that okay with you?
Yes, doctor.
So, Mr. Johnson, can you please tell me what brings you here today?
Doctor, I'm having some pain at my right knee joint for the last 1 month. It has started gradually, and it is bothering me a lot, doctor. Please help me, doctor.
I'm really sorry to hear that. So, is it the first time this kind of knee pain happening to you?
Yes, doctor. This is the first time.
Okay. Is it increasing day by day?
I think so, doctor.
I'm really sorry to hear that. Anything that makes it worse?
Activity makes it worse, doctor.
Okay. Anything that makes it better? Have you tried anything?
I try to improve it by taking rest, but it is not improved to that extent, but I feel some relief.
Okay. I'm really sorry to hear that. Okay. Does your knee pain increases any particular time of the day?
Actually, especially at the end of the day, after doing some activity the whole day long, I think my pain is increased.
Okay. Okay. Can you please tell me the quality of your pain?
Like it is dull pain, doctor.
Okay. On the scale of 1 to 10, how would you like to grade your pain?
Doctor, it is 6 out of 10.
Okay. Okay. And if you need any pain medication right now for your pain, let us know. I can arrange you for it.
Okay, that will be very much helpful, doctor. Thank you for that.
Okay. Okay. So does your pain goes to anywhere from your knee?
No, doctor.
Okay. Okay. So may I know, do you have any fever?
No, doctor.
Okay. Any recent history of injury?
No, doctor.
Any trauma to your knee?
No, doctor.
Do you have any other pain in any other joints?
No, doctor. I only have pain at my knee joint.
Okay. Okay. So do you have any past medical condition that I should be aware of?
Yes, doctor. I have a blood disease.
Okay. Okay. Do you have any diagnosis for that?
I have forgot about the diagnosis, but for that diagnosis, I have to take repeated blood transfusion.
Okay. Okay. May I know how much blood transfusion you needed?
Actually, I'm undergoing this blood transfusion for the past 20 years, doctor.
Okay. Are you on regular follow-up for this condition?
Sometimes I miss to follow up, doctor.
Okay. I think it will be wise if you maintain your follow-up regarding that. And I can arrange you to the blood doctor your follow-up for that if it's all right for you.
Okay, doctor. That will be very much helpful.
Okay. So, so other than this transfusion of blood, do you take any other medication for your blood condition?
No, doctor. I don't take any medication for that.
Okay. Okay. Have you recently underwent any surgery?
No, doctor.
Any procedure?
No, doctor.
Okay. Do you have any significant family history that I should be aware of?
My brother also has the same blood problem, doctor.
I'm really sorry to hear that. How is he doing now?
He is also undergoing same type of blood transfusion, such as me.
Okay. 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 So, did your blood doctor prescribe any medications to reduce your some kind of iron or something in your body?
Actually, doctor, I cannot remember, but I missed to follow up.
Okay. 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 So, okay. Do you have any weight change recently?
Yes, doctor, I did lost some weight.
Okay. Was it unintentional?
It was unintentional, doctor.
Okay. So, how many kgs for how many days?
It is actually about 5 kg. It is about 4 kg for the last 3 months.
Okay. Have you noticed any lumps and bumps in any parts of your body?
No, doctor. Actually, my tummy becomes bigger. My tummy is getting bigger day by day. Apart from this, no other lumps and bumps.
For how long you notice this tummy distension?
It is there for the last 4 months, doctor.
Okay. Okay. Any history of tummy pain?
No, doctor.
Okay. Any change in your back passes?
No, doctor.
Okay. Any passes of black tarry stool?
I have not noticed any black taste, doctor.
Okay. How about your waterworks? Any
It is
change in
normal.
color or quantity?
It is normal, doctor.
Okay. Any history of throwing up?
No, doctor.
Any history of throwing up of blood?
No, doctor.
Have you noticed any a yellowy discoloration of your eyes and hands?
Yes, doctor. I have noticed it. It is occurring there for the last 4 months.
Last 4 months. I'm really sorry to hear that. Is there any itching?
No, doctor. No itching is there.
Okay. 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 So do you have any swallowing difficulty?
No, doctor.
Any history of any blood vomiting?
No, doctor.
Okay. Have you recently traveled to anywhere?
No, doctor. I did not travel to anywhere.
Okay. I'm sorry to ask you this personal question. Do you take any party medication?
No, doctor. I don't take any party medication.
Okay. Any history of needle sharing?
No, doctor.
Okay. So do you have any regular partner?
Yes, doctor. I have my wife.
Okay. I'm sorry to ask you this again. Any history of casual contact?
No, doctor.
Okay. Any history of tattooing or piercing?
No, doctor.
Do you smoke?
No, doctor. I do not smoke.
Okay. Do you drink alcohol?
Yes, I used to drink, and I drink within social limit.
Okay. As you know, you are having this condition. It will be wise to stop driving, stop drinking alcohol as a whole. If you need any assistance regarding that, our Alcohol Anonymous group is there for you if you need any assistance for that.
Okay, doctor.
So
I shall give it a try.
what you do for living?
I'm a banker, doctor.
Does your current condition affecting your day-to-day life?
Yes, doctor. It is affecting a lot. I cannot attend my job for this, and I'm actually not attending the follow-up due to my busy schedule. And right now, due to this pain and also the distension of my tummy, I don't feel that I am able to do my work.
Okay, if that is the case, we can involve our occupational health department. They will guide you further regarding that. Is it all right for you?
Okay, doctor.
So do you drive?
Yes, doctor.
So Mr. Johnson, now you are having this knee pain, it will be wise if you stop driving for a while, and after things are sorted out, we can think what can be done regarding driving, if it's all right for you.
Okay,
So,
doctor.
anyone notice that you are behaving unusually recently? Any unusual behavior recently?
No, doctor.
May I examine you?
Yes.
Okay, I would like to know the vitals, including any postural drop.
Postural drop is absent.
Okay, I would like to know the bedside blood sugar and also urine divistic later part of my examination.
Okay, noted.
I would like to start from the knee. First, I would like to know the proper exposure.
Okay, then.
Then I would like to first of all then feel the temperature and tenderness and tapping.
Okay, temperature is not raised, tenderness is present, and tapping, there is fluid inside the joint.
Okay.
Tapping
I would
positive.
like to do the active and passive movement of the knee joints.
It is, yes, it is possible. 2
Okay,
minutes
Mr.
left,
Johnson,
doctor.
have you noticed any skin changes recently?
Yes, doctor, I'm getting tanned.
Okay. I would like to do the full skin survey of this gentleman.
Okay, there is tanning of skin.
Okay, I'd like to go into the hand. First of all, is there any clubbing and
Absent.
leukoplakia?
Leukoplakia is present, clubbing
Oh.
is absent.
Okay, is there any palmar erythema?
Yes, present.
I would like to check the flapping tremors.
Absent.
Okay, I'd like to check for anemia and jaundice.
Absent. Jaundice is present, mildly jaundice.
Okay, yeah, I would like to take a good look on the face if there is any thalassemic face.
Instead of that, there is hepatic phases, the temporal wasting.
Okay, I would like to determine, first of all, is there any organomegaly like hepatomegaly or splenomegaly?
Splenomegaly is present.
Okay, I would like to check the ascites.
Present.
Okay, I would like to sit up the patient and check for the lymph nodes and also base of the lungs.
Okay. Crepitation is absent. Wonderful.
I would like to complete my examination by checking the gait.
Okay. Noted. Patient cannot walk due to pain.
So what is your concern, Mr. Jones?
Doctor, why I'm having this knee pain, doctor?
So, Mr. Johnson, after talking to you and examining you, I think there is some crystal deposited into your knees. That's why you are having this pain. And this is happening because some other condition you have been suffering. Would you like me to share it with you?
Yes, doctor.
So, as you are having this repeated blood transfusion, there might be some excess amount of iron in your body that is going to be deposited various parts of your body. As you missed this iron removing agents that was prescribed, it will be wise if you start taking this. And for that reason, we will also involve our blood doctor and gland doctor and liver doctor as well. Any other
Doctor,
concern?
do I need to get admitted?
Right now, we will run some tests and keep you in observation. And after the reports are in my hand, I can talk to you again if it's all right for you.
Okay. Also say that I will talk to my consultant, and in the meantime, he will come and see you. Are you getting that?
Okay. Yes.
Okay. Don't just remove, keep him waiting at the observation room. Okay. So time's up, doctor. So do we have any diagnosis or differential diagnosis?
So for this knee pain, I have some differentials in my mind. It could be a case of pseudo gout. It could also be a
Yes,
case
wonderful.
of gout, and it could also be a
Wonderful.
case of osteoarthritis as well.
Okay. Points in favor and against?
Okay, for as this gentleman having repeated blood transfusion and this repeated blood transfusion, which has most probably led to the secondary hemochromatosis, and that is that
Yes.
may cause pseudo gout, and that secondary hemochromatosis can also cause some other conditions like osteoarthritis, and also gout can be a possibility as repeated blood transfusion itself can cause gout as well.
Okay. So what are the positive physical findings you have got from this gentleman?
On my examination of this gentleman, I could appreciate there is tenderness and a restricted movement of the knee joints, and there is a gait is not possible to see due to pain. And the examination of hands, there was leukoplakia and palmar erythema. I could appreciate there is hepatic phases, and there was some jaundice as well. On abdomen, I could appreciate there is splenomegaly and there is ascites as well.
Did you check for body hair distribution and the gynecomastia?
No.
We have to check it, doctor. Believe me, for every cases in the India, which is CLD, there may be gynecomastia. Please check it.
Yeah.
It is also important for the abdomen station. Okay. So what are the investigation you would like to do for this gentleman?
First of all, I would like to do a X-ray of the knee joint and also ultrasonogram and if needed MRI of the knee joint. Then I would like to do some other tests like serum uric acid as well and CRP and CBC with ESR as well. Then to ESR as well. To check the cause, I would like to do a random blood sugar, OGTT, and hemoglobin A1C, and
Is it to
also
find out the cause?
yes.
What is the cause, doctor?
Okay, to find out the association actually.
Yeah. Okay, doctor, that is the thing. To find out the cause, what will be the investigation?
To find out the cause, I would like to rule out gout. So I would also rule out gout and septic arthritis as well. So I would, after doing the full coagulation profile, I would like to do the aspiration of the joints as well.
Yeah, aspiration of joint. Anything else you want to do to confirm your diagnosis apart from checking the uric acid and aspiration of the joint?
Yes, the imaging of the joints.
What about ferritin or transferrin saturation?
Yes, to check the association, I was about to tell you as to check the association. I would like to do the iron profile, including the transferrin saturation and serum ferritin as well. And then I would like to do an ECG, echocardiogram, chest X-ray.
Okay. Yeah, you are right, but I think you are messing it up because hereditary. What are the investigation to confirm the hemochromatosis, doctor?
Transferrin saturation.
First, we have to examine the joint fluid, then transferrin saturation. So it will form. It will be inside the to find out the cause, not in the association, doctor.
Yes.
No problem. It will be automatically become okay. So, what are the? How will you like to manage?
For management purpose, first I would like to take some general measures, including patient education, explanation, build up nutrition, vaccination, and form a give him nutritional support, and form a multidisciplinary team involving a rheumatologist and then hepatologist, a hematologist, endocrinologist, and specialist nurse and occupational
Let me pause
therapist.
and make you correct one thing. Let me give you an example. Like you have told rheumatologist. Do you think it is necessary to involve rheumatologist for this case?
Okay.
Actually, I'm sharing a practical experience. During my first attempt at Bangalore, I got a case at cardiac station that was mitral stenosis. And during telling the management, I tell that I will form a multidisciplinary team. And inside the multidisciplinary team, I will involve the cardiologist, the hematologist, and all things like that. At that point, the examiner struck me at that point that he asked me, why will you involve hematologist? Only for management of mitral stenosis, you will involve the hematologist. I just replied that before starting for anticoagulation, I'd like to take the consultant. And all my examination was ended only at that point because I involved someone who is not necessary. For the UK, they assess whether I am able to form a multidisciplinary team and I am able to select the members of the multidisciplinary team. Are you getting me, Dr. Partho?
Okay.
And it is not necessary to show you knowledge. You may not know anything, but you are able to, you know where to refer the patient and which person you have to contact with. So for the PCS exam, my suggestion will be don't utter the name of the multidisciplinary team. Don't utter the name of the members. Just tell forming a multidisciplinary team. Because at the exam, due to some hurriness or due to some anxiety, sometimes some name of the members can come out of your mouth, which will create some problem for you. Are you getting it?
It happens. Yes, it happens. And last time
doctor.
in the coaching, they also bucked me regarding that in the cardio station.
Have you got it, doctor? Are you able to match it? It happens, doctor. So better to avoid telling the members of the multidisciplinary team. Just tell, I will form a multidisciplinary team. That's all.
Okay.
Okay. Then proceed, doctor.
Okay. Then after the specific management will be according to cause.
Yeah. Then take some pause.
For that means for. Okay.
Take some pause, doctor. Don't be hurry. This is the trick. Don't give all the answer in one go. Tell in slow speed. Don't be hurry. If you do hurry, you will likely to complete more ahead of time. And it will invite the examiner, it will give the chance the examiner to ask another question. But believe me, if you can answer the investigation and management in proper way, they will give you full mark in the clinical judgment. So let the examiner ask some question. That you will be tell like education and counseling, forming a multidisciplinary team, treatment of the underlying cause, and treatment of the complication. After that, the examiner will ask you, suppose the underlying cause is hemochromatosis, what will be management? Give me your answer, doctor.
Okay. Then if it is hemochromatosis, then repeated. Then I should give him some medical management like aspirin, and also I would like to refer him to the hepatologist and think about
Doctor,
giving
for joint pain, for hemochromatosis, tell one thing only, one medication.
for hemochromatosis.
Yeah, suppose the joint pain is due to hemochromatosis. I'm telling you, the examiner is telling you that suppose the joint pain is due to pseudogout, due to secondary hemochromatosis. So what will be your management?
Okay, if it's due to gout secondary to hemochromatosis, then there are some options can be thought, like intraarticular steroids.
Yes, first pain management, then
And then management of the hemochromatosis,
what is the
iron
management
chelating
there?
agents.
Yes, that is the thing, doctor. Then the examiner may ask you, what are the other complications of hemochromatosis? Tell me the answer.
Okay, and then it could be there could be diabetes mellitus,
Yes,
and there could be also dilated cardiomyopathy.
yes. So how do you manage that?
So I will for diabetes management, I like to consider insulin, but I would like to consult with the endocrinologist.
That's all. For heart failure management, what will be the immediate management? And what will be the long-term management?
For heart failure management, the treatment of hemochromatosis improves the heart failure, and but I would like to cardiologist.
Yes. After starting for furosemide, I would like to take consultation with the cardiologist. That's all, doctor. This is that much simple. So unless you go to you lose your track, the examiner will not put you into some condition, some difficult condition. So you have to guide the examiner in your way. Is it clear, doctor? I hope you will practice in this way from now. So let us start. So Dr. Raisa, are you there?
Yes.
So this was knee pain due to pseudogout. So regarding physical examination, how would you like to keep the judgment?
Missed the CLD signs, missed for checking gynecomastia and body hair.
Yes, doctor. Yes, doctor. Such a good revenge. Gynecomastia.
And is an issue also.
Yes, it is good, doctor. Constructive criticism is very much good because that will help you in the long run. And also miss to check the body hair. This is for his improvement. This is not for your improvement. So based on this, how would you like to keep the mark?
Borderline.
Yes. Then identifying physical signs.
Yes, he did well. Just maybe might be need to say that I need to check the private purse for any atrophy, but it's okay.
It is not allowed. It is not allowed in the PCS exam to examine for private. Yeah, he can offer, but it will be not allowed. But he has not examined for gynecomastia, and he has missed it. Same like your gait.
Okay.
And there is decreased body hair also. There is decreased body hair also, doctor. CLD patient with decreased body hair. And in identifying physical sign, he has not mentioned it.
Yes.
Yes.
So what will be marked in identifying physical signs, doctor?
Borderline.
Yes, this will be same borderline. Then clinical communication skill.
In the history taken, he didn't ask for.
I'm sorry to interrupt once again. Bhaiya, as in the picture, the patient didn't have any gynecomastia. So should it be routine or should I base this on my judgment? Like visually there is gynecomastia, then I go for it.
It is not visible. We have to examine it. Gynecomastia cannot be diagnosed only by seeing the patient. We have to feel for gynecomastia. And
is it allowed feeling for
yes, doctor.
gynecomastia?
Yes, doctor. I appeared at the exam for 2 times, and both the times at the abdomen station, there was gynecomastia, and I found it. The first time at the Bangalore, it was a case of hepatic transplant, liver transplant, and the patient had gynecomastia. Second time at the Pondicherry, the patient was alcoholic patient. He was having parotid enlargement, also the gynecomastia. After taking palmation, I palpate for the chest, and I found clear disc at the nipple, beneath the nipple. This is their doctor.
Then please tell us the sequence. So we need to tell him to raise his hand above the head to see for it and then palpate, or what?
Actually, it has been described in the physical examination video. The sequence of the examination for any abdomen case. Like we have to tell the patient to raise the arm, first to check the body hair distribution. First the axilla, then at the chest. Then also after taking palmation, that do you have any pain around your nipple? If the patient tells you that no, then after taking palmation, we have to palpate for gynecomastia.
Okay, thank you.
Okay. So, Dr. Raisa, what will be judgment in clinical communication skill?
In clinical communication, he needs to take the history of problem in intimate relationship, which is a
Yes, doctor.
complication of hemochromatosis.
Yes, doctor. There was a complaint of erectile dysfunction. He has to ask this because this is one of the complaints of hemochromatosis. Wonderful, doctor. I am noticing that you have noticed it one carefully. Then?
Okay, and if I keep gout as my differential, then I need to take diet history as well.
Yes, diet history has to be taken if we tell the gout.
Gout is our differential.
Yeah, but it is negligible because gout is not will be the differential for this case. But he has told us you to repeat blood transfusion. It is better if he takes the history of diet, but if he does not take, it is negligible.
Okay.
Because cases in the PACES exam is not that much difficult. Like we are putting so much thing inside one case. This does not happen actually. Most of the time, the cases are very much easy. Okay, then, doctor.
Okay, and okay.
So based on this, what will be your judgment?
I can give satisfactory.
Okay. Then differential diagnosis?
It was okay.
Yes. And the clinical judgment?
Clinical judgment is okay, but he said aspirin is not given in either pseudogout or
yes, doctor, aspirin is not given. Yes, he told it to prevent any, this is not given actually. Aspirin is not given. Are you getting it, Dr. Partho?
Yeah. I just forgot to, I just mixed it up with hereditary hemochromatosis.
Okay.
Even if we take gout as differential, then aspirin can clear.
Aspirin is contradicted. Yes, doctor.
Yes.
Only for asking.
Yeah.
I'm telling you that the Pondicherry and Delhi candidate examiners are sensitive. Please keep it in mind. The cases are very much simple and well to do. So if you miss any simple thing or if you do something that is extremely controversial, they will give you unsatisfactory. But otherwise, they will give you satisfactory. It's very much easy to get full mark from them. So based on this, how will you give the judgment, Dr. Raisa?
I'd give borderline for the aspirin only.
Hello.
Yes, doctor.
So, sir, what painkiller should we offer for this patient?
For hemochromatosis, if there is liver involvement, we cannot go for NSAID actually. We just have to tell that he has told that intra-articular steroid is an option.
Okay. No. So we will directly consider intra-articular steroid, or
we start with paracetamol.
Or we can offer oral steroids as well.
Better to avoid it, doctor. Oral steroid has some side effect. First, we will start with paracetamol. Then opiates is not indicated because he is having liver involvement.
Correct.
We can go for intra-articular steroid.
So paracetamol and directly intra-articular steroid. Okay.
Yeah. And in the exam, there is a technique like you will never be asked that what painkiller you like to choose.
Yeah.
So in the exam, better to give the answer in breakdown. Like I will keep pain medication.
Okay.
I will manage the pain. that is the way to save your back at the exam.
Okay. Thank you.
So, regarding concern, what will be your judgment, Dr. Raisa?
It was okay.
Okay, and welfare is also okay. So
Okay.
based on this, what will be his total mark from each examiner?
11.
Out of what? Yes, 11. So it will be 22 out of 28. Dr. Partho, are you getting it?
Yes, brother. Yes.
So don't worry, this will automatically become 28. We are trying here to be more judgmental, to make you improve.
Yes, yes.
So right now, you have to practice with Dr. Raisa, and Dr. Raisa has to practice with Dr. Partho. And you have to make yourself judge each other using such mark sheet. And as far as I remember, both of you are Pondicherry candidate. So please practice with each other and do some valuable improvement. So thank you, doctor. So let me proceed to the next candidate. So Dr. Kia, are you there?
Yes, ma'am.
And Dr. Brevis, are you there?
Yes, sir.
Okay. So you'll be now form the pair. I will throw a case to Dr. Kia, and Dr. Brevis has to keep the judgment. So, Dr. Kia, are you seeing the screen?
Yes.
Okay. You have 2 minutes time. After that, you have to start taking the history. So regarding the earlier cases, this is not for Dr. Partho and Dr. Raisa. It is for Dr. Sabbir. He was getting a case of psoriatic arthritis, and the patient was having psoriatic rash. So one thing I missed to tell that he has to offer some safety netting for the rash. He has to offer that avoid sun exposure, and also has to tell to the examiner that we please inform the doctor before starting for any medication in the future, because there are some medication-induced exacerbation of psoriasis. Actually, this will become clear after we attend our dermatology session. There, I will discuss in detail how to approach to a case of psoriasis. Are you getting it, Dr. Sabbir?
Yes, I get it.
Okay. And regarding one thing more, sometimes we don't know where we have to refer for the occupational problem. Like a candidate was getting a plumber and he is having some problem. So the occupational health department is for the institution, like the patient is working at a bank or working at any institution. There the patient has occupational health department. Otherwise, he will not have. Like any person is driving his own car. So that patient will not have an occupational health department. So what we have to do at that case, there is a technique to save your back. The technique is we have to just tell the patient how this symptom is affecting your day-to-day life or job activity. If the patient complains that, yes, I'm having some difficulty, then we have to ask the patient, do you need any kind of support from our side? If the patient replies that, yes, I need some financial support. So even if you forget the department to refer for financial support, just tell the patient that, okay, for that, I am going to refer you to the responsible authority. It is not mandatory to remember the name of the authority. I just tell that I refer you to the responsible authority to meet your concern. Is that okay with you? Okay.
Doctor, in case of CLD, the last case, the hemochromatosis complication, we should stop the alcohol.
Yeah, that has been done wonderfully by Dr. Partho.
Okay.
Because there is liver involvement.
Okay.
So Dr. Kia, are you ready?
Yes. Okay. Yes.
Okay, start.
Okay. Hello, I'm Dr. Nahar, one of the doctor in this clinic. So am I talking to Mrs. Anderson, 50 years of age?
Yes, doctor. I'm Mrs. Anderson. I'm 50 years old.
Okay. So today we are here to talk about your health condition, and side by side I will examine you and might take some notes which will be fully confidential, and my attention will be with you. Is it all right, Mrs. Anderson?
Sure, doctor.
Okay. So in your own words, please tell me what brought you here.
Doctor, I'm having some severe back pain for the past 5 days, doctor, and it is bothering me a lot. Please help me, doctor.
I'm really sorry to hear that. Okay, I will give you some pain medication to manage your pain after we are having this conversation. Is it all right?
Thank you, doctor.
Okay. So, is it the first time you are having this sort of pain?
Yes, doctor. This is for the first time.
Okay. So, okay. Okay. Did the pain come on suddenly or
Yes, doctor.
gradually?
It started quite suddenly, doctor.
Okay. And till then, is it increasing, decreasing, or the
Yes,
same in
doctor.
intensity?
It
It's
is increasing,
increasing.
doctor. I think it is
Okay,
beyond tolerable.
Okay, I'm sorry to hear that. Can you show me where it takes the most?
Okay, patient is showing his wall back at the spine.
Okay. Is there any visible deformity, scar,
No.
or
No.
redness? Okay,
No.
thank you. So, okay, can you grade the pain from 1 to 10, 1 being the lowest and 10 being the highest in pain?
Doctor, it is 7 out of 10.
That is so much pain.
Yes,
You are in
doctor.
pain. Okay, okay, Mrs. Anderson. So, what is the character of this pain? Is it dull, sharp, or can you
It is dull
describe,
pain,
please?
doctor.
Okay, and is it coming on and off or all the time?
It is there all the time from the onset, doctor. I cannot bear it right now, doctor. Please help.
Okay. I'm sorry. Have you noticed any variation in the pain during the day or at the later part in the night?
No, doctor.
Okay. And does the pain goes anywhere from your lower back?
No, doctor.
Okay. And okay. Do you wake up at night with pain?
Yes, doctor. Sometimes I have to wake up at night due to the severe pain.
Okay. I'm sorry to hear that. Okay. And so is there any other joint pain along with it?
No, doctor. This is the only site I am having this pain.
Okay. And any morning stiffness when you wake up from sleep?
No, doctor. Have to tell morning jamming, not stiffness.
Morning
Stiffness will be
jamming.
jarring.
Morning
Yeah.
jamming.
No,
Sorry.
doctor.
Okay. Is there any morning jamming when you wake up from sleep?
No,
No.
doctor.
Okay. And okay, was there any trauma to your back?
No, doctor.
Okay. And okay. Have you noticed anything makes your pain worse, like walking, climbing upstairs?
Doctor, the pain is so severe that I am not able to walk.
I'm sorry. And anything makes your pain better, like taking rest or taking any medication?
No, doctor. It is there all the time.
Okay. Have you noticed any other complaint along with it you would like to mention?
Like what, doctor?
Like high body temperature?
No, doctor.
Okay. And okay, so I'd like to ask you some more question.
Okay.
Have you noticed any weakness in your legs?
No, doctor.
Any tingling, numbness, or abnormal
No,
sensation
doctor.
in your legs?
No,
Any
doctor.
change of sensation in your private parts while you are using water?
No, doctor.
Okay. And any, I'm sorry to ask you, any loss of your bowel or bladder control?
No, doctor.
Okay. So, okay. Do you have any known medical condition that I should be aware of?
Right now, I'm not having any non-medical condition, doctor.
Okay. Any high blood sugar,
No, doctor.
high blood pressure,
No, doctor.
any kidney problem?
No, doctor.
Can I see your medication chart?
Right now, I'm not taking any kind of medication.
Any recent stoppage of any medication?
No, doctor.
Okay. Any medication called steroid anytime?
No, doctor.
Okay. Any over-the-counter medication for your pain?
No, doctor.
Any herbal medication?
No, doctor.
Are you allergic to any medication?
No, doctor. I'm not allergic.
Okay. Any history of any surgery done to you?
Yes, doctor. I had some surgery over my breast.
Okay.
I
And
had breast cancer.
Okay. And when was it? I'm sorry to hear
It
that.
was 10 years back, doctor.
Okay. And for after that, did you receive any treatment for your cancer?
Yes, doctor. I received chemotherapy and I was declared cured.
Okay. And when were you declared cured?
It was 8 years back, doctor. And I was attending for follow-up regularly, but I think for the last 2 years, I am not attending the follow-up because I think it is not necessary right now.
Okay. And is there any other reason you have lost to follow up?
I just don't did it intentionally, doctor.
Okay. And recently, have you noticed getting paler day by day?
No, doctor.
Any yellow discoloration of the white of your eyes?
No, doctor.
Any lumps and bumps have you noticed anywhere in your body?
No, doctor.
Have you checked your breast recently? Any lumps and bumps there?
No, doctor.
Okay. And apart from these, have you ever done any procedure done to you? Was there any
No,
procedure
doctor.
done to you? Okay. And any history of any blood blood transfusion?
No, doctor.
I am going to ask you some personal questions for medical reason. Is it all right?
Yes, doctor.
Do you smoke, Mrs. Anderson?
Yes, doctor. I used to smoke, but right after the diagnosis of my breast cancer, I have stopped that.
I appreciate that. And do you drink alcohol?
Sometimes at the weekend, doctor.
Is it within social limit?
Yes, doctor. It is within social limit.
Do you binge anytime?
No, doctor.
Okay. And what about what do you do for living?
Doctor, I work as a librarian.
Okay. And how much your illness is affecting your job life and day-to-day
Yes,
life?
doctor. It is affecting a lot, doctor.
Okay. And if you need any help, well, we can involve the social care worker to manage you some help at home and also at work to manage your
Okay,
symptom.
doctor.
And
Okay,
we'll
doctor.
also involve
Thank
the
you.
occupational healthcare physician as well. And okay. And do you drive, Mrs. Anderson?
Yes, I used to drive.
Okay. As you're having severe back pain, this might affect your driving. So I'd advise you to stop driving for now until we get this sorted. Is it all right?
Okay, doctor. Okay,
Okay.
okay,
And I
doctor.
want to ask you some personal question. So what about your monthly cycle? Have you stopped?
Doctor, I have added menopause, doctor.
Okay, thank you. And okay, so I want to start examining you. I want to
Okay, what do you want to see?
start from the lower back. I want proper exposure to start examining.
Okay, okay.
I want to check for any visible scar, deformity,
Absent,
gibbous.
absent.
Okay, and then I want to feel the spine, the whole spine, with special attention to the lower spine to feel the gibbous or deformity and tenderness.
Absent.
I would look at my patient's face while I'm palpating the spine.
In the
Okay.
real case, it will be surrogate. There is no
Okay.
pain there.
No pain. Okay, and then no warmth, no temperature, no
No.
tenderness. And then I will ask my patient to stand up. Would you please stand up for me?
Yes, I can
Okay.
stand up.
Can you move your lower back for me,
But
like
doctor,
side? Can you
it is very
flex
much
bend
painful.
for? I'm
It is
really
painful. I
sorry.
cannot do that.
Okay. Could you please walk for me?
It is painful, doctor. I cannot work for that.
Okay, I'm sorry to hear that. Then please lie down. I want to examine your legs. I want
Okay,
proper
what do you want
exposure
to
of the
see?
legs. Can you
Okay,
please raise your legs, like right
normal,
legs, without bending your knee? Is the SLR positive? I want
negative,
to look at the same time, left leg. Then I want to examine the lower
normal.
legs for tone, power, reflex, plantar, sensory, and
All are normal.
coordination. Okay. Then I would like to start general examination after complete covering her legs. I want to start from the hand. Okay, so I
wonderful.
want to know the vital charts, including pulse, blood pressure, any postural
Normal,
drop,
doctor. 2
and
minutes left.
saturation. And I want
No.
to touch your face. Is it all right? I want to check the
Yes, doctor.
face for anemia and jaundice.
Absent. Absent.
Okay. Okay, I want to check I want to examine her breast with proper exposure and female attendant.
Okay, noted, doctor.
And I want to check the cervical and axillary lymph nodes for any lymphadenopathy.
No lymphadenopathy is there.
And what about the scar over the breast? Is it healthy, or is there any tenderness and discharging sinus?
Healthy. Very good.
Okay, thank you. So I will cover you up. Thank you for helping me, Mrs. Anderson. What
Thank
is
you,
your
doctor.
concern?
Doctor, why I'm having this back pain, doctor?
Okay. After talking to you and examining you, I have some possibilities in my mind. On top of that, you were diagnosed as having cancer in your breast, though it was surgically removed, and also you got some therapy after that and was declared cured. But this time your back pain is having some sort of danger sign. I am sorry to tell you. So I'd at first like to rule out if the cancer is back and whether the cancer has already spread to your bones. Are you getting me?
Yes, doctor. Doctor, do I need admission?
As you are in severe pain and it is already affecting your walking and also day-to-day life, yes, I would like to admit you. I will run some urgent imaging of your spine to look at what causing you pain, and we will involve a group of specialists, and I will come back to you. And meanwhile, I will talk to my consultant and come back to you.
Okay, doctor. Thank you.
Okay.
So time is
Thank
up.
you.
So, doctor, do you have any diagnosis or differential diagnosis?
Differential আসলে set করতে পারি নাই. For this
Just
case,
tell that
I'm thinking.
you can tell the mechanical back pain causes like trauma. Against
Yes.
that, the patient is okay. Tell me the first differential
I have
diagnosis.
some differentials. This could be metastatic vertebral metastasis from her breast cancer. And
Yes.
another thing I'm thinking of any traumatic, but she doesn't give any history of trauma, and also
Yes.
osteoarthritis. Still, that is the rare in axial joints.
Yes. Tell these points against the differential diagnosis. Anything in the chart, in the flow chart I have provided to you, you can tell all the mechanical back pain causes, but you have
And
to tell
also she
points.
has got anti-cancer treatment, so osteoporosis,
Yes.
Considering her age and she is more postmenopausal, will be another possibility.
Yes, doctor, that will be the answer. So what are the positive physical findings?
Okay, from examining her lower back, I could not appreciate any tenderness or any deformity. Her lower limb examination reveals normal findings. She can't walk due to pain, so I could not appreciate the gait. And there is a scar mark over her breast, but I
Yes.
could not appreciate any lymphadenopathy or any lump in her breast as well.
Okay, that is the only physical finding. In the PACE system,
Okay.
they don't want to know the negative findings. They want to
Okay.
hear the positive findings only. If you ever tell the negative findings that I have not found this, they will make you stop and tell you that don't waste my time.
Okay.
I have been told like this.
Okay, I was thinking about important negatives, that hence I was talking
No,
about.
never.
Okay.
No.
Okay.
Never ever tell it in the PACE exam. If you ever tell it, the examiner will make you stop. This is for the native exam, not for the PACEs. Okay.
Okay.
How would you like to investigate?
Okay, so at first, urgent X-ray of the lumbosacral spine and also MRI of the lumbosacral spine with contrast. Yes.
Tell
please.
professionally.
Okay. So to confirm my diagnosis.
No.
Apart from
Yes.
routine investigations.
Yes, doctor.
I would like to do imaging, MRI of the lumbosacral spine with contrast to confirm my diagnosis. And also, if there is any suspicious lesion, we might take CT or MRI guided FNAC from the lesion and do histopathology to confirm. And
Then?
to look for complication, I want to do the complete blood count to look for any anemia, and also mammography and ultrasonography of breast to look for any suspicious lump.
Then?
Also, we can do contrast in her CT scan um, uh, to look for any lymph node involvement. We can do PET CT as well.
Do you think you need to do the ultrasonography of the abdomen?
Yeah. Yes. Yes.
Did you?
Whether it has already spread to other organ like liver.
And during physical examination, do you need to palpate the liver and look for ascites?
Yes, I do.
Yes, doctor. That has to be done. Okay.
Okay.
Then what will be the management?
Okay, so as my patient is in severe pain, at first I want to manage her pain with appropriate pain medications and education and counseling her about the disease and formation of a multidisciplinary team. And also
First, what will be initial management? Admit the patient or?
Admit the patient because she is in severe pain. 8 out of 10.
Yeah.
Then education and counseling about the disease, pain medication with appropriate pain management with appropriate pain medication, formation of a multidisciplinary team.
Okay.
And treatment of the cause.
Yeah. Suppose the cause is metastasis. What will be the management?
Okay. In that case, our multidisciplinary team will involve oncologist and palliative care.
That's all.
Sorry. Okay. Thank you.
That's all. That's all. I'm just stopping you because don't tell anything after that. It is your job to involve the multidisciplinary team, to involve the oncologist and the palliative care team.
Okay.
Rest will be taken care by them. Okay. So let us analyze your performance. So I will suggest Dr. Kia that during any admission case, that whatever case you have to admit, after admission, try to tell the management of airway, breathing, and circulation. Are you getting it,
sorry.
doctor?
I missed it. Yeah.
Yeah. Try to practice it. It is very much simple. So, Dr. Brevis, are you there?
Yes, sir.
So, it is a case of low back pain. Due to metastasis. So, regarding physical examination, how would you like to evaluate Dr. Kia?
She did okay, sir. Satisfactory.
But did he palpate the abdomen?
Yes, she didn't palpate the abdomen.
Why this is important?
For metastasis, sir.
Yes,
for the liver, because we are suspecting that she has a metastatic disease in the spine. So we have to see in the abdomen.
Yes, doctor, we have to see the abdomen. So based on this, what will be your judgment regarding satisfactory, borderline, or unsatisfactory?
Sir, I would still like to give a satisfactory only, actually. But yeah, we can give her borderline because we have to be marking strictly with each other.
Yeah, I will suggest to be strict.
Yes.
Because we are here to make improvement, not for giving some something like that. So I will suggest to keep borderline here.
Right.
So it will help her to improve in the long run.
Exactly, and I will remember this. Yes.
Yes. Then identify physical signs, Dr. Brevis.
Yeah, she identified.
So what will be the mark here?
Satisfactory.
Yes, satisfactory. Then clinical communication skill.
It was good, sir. Satisfactory.
Yeah, it will be satisfactory. Then differential diagnosis.
So it was also good, satisfactory.
Clinical judgment.
That was also satisfactory, sir.
And concern is also satisfactory.
Yes.
Welfare is also. So based on this, out of 14 from each examiner, what will be her total mark?
13.
Yes, 13. So from 2 examiner, it will be 26 out of 28. This is a good mark to start with. Because I have personally seen some candidates, initially they used to get 8 or 6 marks. But at the end of the course, they got 28 out of 28 and they have wonderfully passed the exam. So, Dr. Kia, do you have any question from this prompt?
No, thank you. Yes, that's what it's needed, the exam date score. So
Yes.
pray for
And
me.
in
Thank you.
this way, you have to practice with each other. Right now,
Hello.
I will. Yeah, doctor.
Sir, so apart from metastatic spine disease and osteoporotic fracture, anything else we can keep as differential here?
Actually, we have to go back to our previous day class. Let me delete. So this is the approach to low back pain. And these are the causes of mechanical low back pain. This can be due to trauma or it can be due to septic arthritis. The causes of septic arthritis can be tuberculosis or discitis or brucellosis. Then it can be due to osteoporosis or osteoarthritis or metastasis, multiple myeloma, prolapse of lumbar intervertebral disc, and Schwartz hematoma. You can keep all them in the differential diagnosis, but at the same time, you have to tell the points going against them. Like in this case, she has picked up metastasis as first degree, then osteoporosis is the second degree. Yes, there is nothing against it because she is postmenopausal, so osteoporosis can be likely diagnosis. She has told a third degree as a trauma, but against that, there is no history of trauma. She can also pick up the septic arthritis, but against that, there is no history of fever. In this way, she can tell. Is it clear, doctor?
Yes, sir. Thank you.
Okay. So right now, I'm giving case to Dr. Brevis and Dr. Kia will be the examiner. So Dr. Brevis, are you seeing the screen?
Yes.
So this is your case. Take
Yes.
preparation for that.
We can start.
Yes, doctor, we can start.
Hello, I'm Dr. Bhadraj, one of the doctors in the examination today. Am I speaking to Mr. Henderson, 40 years old?
Yes, doctor, I'm Mr. Henderson. I'm 40 years old.
So, Mr. Henderson, today we are here to discuss about your health condition. While I'll be taking the history and examining you, I'll be jotting down few notes, and that's going to be confidential. And during my examination, if you have any kind of a discomfort and pain, please stop me and let me know. Is that okay with you?
Okay, doctor.
So, Mr. Henderson, what brings you here today?
Doctor, I'm having some hand pain for the last 3 days. It started gradually and it is bothering me a lot, doctor. Please help me.
Okay, so this is the first time in that you have started having this kind of a pain in the hand,
Yes, doctor, this is the first time.
and it started suddenly.
Yeah, actually, doctor, it started gradually.
Okay, and it's been increasing since last 3 days.
Yes, doctor.
So, is it a hand pain or it's a joint pain?
No, doctor. It is hand pain, no joint pain.
Okay, can you show me where exactly is the pain?
Doctor, I'm feeling pain here.
Okay. Fine, Mr. Anderson. So, on the scale of 1 to 10, if I may ask you, how much is your pain?
Doctor, it is 5 out of 10, doctor.
5 out of 10. Okay. So, by the end of the conversation, I'll be offering you for the pain killing, for some relief for the pain. So is that okay to continue right now?
Okay, doctor.
So, what is the nature of the pain, Mr. Anderson?
It is some throbbing pain, doctor.
Okay, I'm so sorry to hear that. And is it
Sharp
going anywhere?
pain. No, doctor,
Okay.
it doesn't go anywhere.
It's not going anywhere. Okay. So, okay, fine. So, I hope you're not got injured here.
No, doctor.
Okay. Any jamming in the mornings you have?
No, doctor.
So, if I may ask you if you have any kind of a past medical history?
Yes, I have kidney problem.
Okay. So, how long back was that diagnosed?
It was diagnosed 5 years back.
And what was the cause of kidney problem the doctors told you?
The doctor told me that it was due to some high blood pressure.
Okay. So, are you going on any kind of a medication or any kind of a procedure for this?
Yeah, I'm taking dialysis for that, and I'm on a medication also.
Okay. And how often do you take dialysis?
I take dialysis 3 times in a week.
3 times. And it's through your arms, or do you have anything in your tummy also to go?
No, it's through my arm. You're seeing. This is the site where I undergo dialysis.
Okay, Ma'am Sanderson, I can see how discomforting it must be for you. Hopefully, we'll be able
Yes,
to
doctor.
find out the solution at the end of our discussion, all right?
Thank you, doctor.
And so when was your last dialysis happened?
It was 3 days back, doctor.
Okay, so since then you've been having the problem in your hand?
Yes, doctor. Since then, I'm having the problem.
Okay, so can I have the medication list?
Yeah, he's taking medication for a CKD like calcium supplementation, dicaltol, and medication for hypertension in the form of low salt and potassium.
Okay. Okay, Ms. Anderson, and are you compliant with the medication?
Yes, doctor. He's also taking hypophos, tablet hypophos.
Sir, sir, I beg your pardon?
Phosphate lowering medication.
Oh, yeah, phosphate, yeah, fine, sir. Okay,
Yeah.
so are you compliant with your medication, Mr. Anderson?
Yes, doctor. I'm quite compliant.
And your blood pressure is also under control?
It remains uncontrolled sometimes, but after taking the dialysis, it becomes controlled.
And are you visiting your doctors regularly
Yes, doctor.
for the follow-ups?
Yes, doctor.
And any other any surgical intervention apart from the this thing which you have got in your arm? Anything else you have got put before?
No, doctor. No, doctor.
For any past any other surgical procedures?
No, doctor.
Any other admissions in the hospital for anything?
No, doctor.
Any family history of the note which I should be aware of?
My mother also was a kidney patient.
Okay. And okay, Mr. Anderson. So how's she now?
She died of heart attack, doctor.
Oh, I'm so sorry to hear about that, Mr. Anderson. Mr. Anderson, I may ask you a few more questions. Is it okay to go ahead with it?
Okay, doctor.
Do you have any raised body temperature?
No, doctor.
Any weight changes?
No, doctor.
How's your water work?
It is reduced actually. It is reduced since my diagnosis of kidney problem was diagnosed.
Okay, and is it any frothy water work?
No, not right now.
Any red color water work?
No, doctor. The amount is just reduced.
Okay, okay. So how's the quantity of intake of your fluids? How much fluids are you taking?
I'm taking fluid as per the direction from the kidney doctor.
Okay. And how's your bowel work?
It is normal, doctor.
Any lumps and bumps in the body?
No, doctor.
And do you smoke, Mr. Anderson?
Yes, I used to smoke, but right now I do not smoke.
It's good to give up smoking, Mr. Anderson, and I'm happy to hear that. Do you take alcohol?
Sometimes at the weekend, doctor.
Okay, and what do you do for your living?
Doctor, I'm a librarian.
And how this problem is impacting your job?
Yes, doctor. For this hand pain, I cannot continue doing my daily activity and also my job activity.
Okay, so don't worry about that. We'll be involving social health worker for this. And do you drive, Mr. Henderson?
Yes, doctor, I do drive.
Okay. Any sexual partner? Sorry to ask this personal question.
Yes, I have my wife.
Okay, as a no casual partners, no?
No, doctor.
Okay, so do you have any headache?
No, doctor.
Any blurring of vision?
No, doctor.
Any weakness of any body part?
No, doctor.
Any tingling numbness?
No, doctor.
Any racing, pacing of the heart?
No, doctor.
Shortness of the breath?
No, doctor.
Any tummy ache?
No, doctor.
Any tummy swelling?
No, doctor.
Any feeling of throwing up?
No, doctor.
Any swelling over any part of your body, like your legs?
No, doctor. I have not noticed any swelling right now. It is there all the time, but right after taking the dialysis, the swelling subsides.
Okay, may I examine you, Mr. Henderson?
Sure. What do you want to examine?
So I'll be seeing the dorsal and the palmar surface of the patient and making. If he's sitting, I'll put the pillow on his lap, make the the hands on the pillow, and I'll first see for the nail changes, any kind of leukonychia or half and half nail, anything
Absent.
in the nail absent. Okay. Any other skin changes, sir?
Absent.
Absent. Okay. So I'll check the pulse. Pulse the same as outside?
Yes, doctor. Same. The volume is normal. The rhythm is normal.
Regular normal volume. Okay. So and the blood pressure?
Blood pressure is same as given outside.
Okay. So I'll go in for the examination, local examination of the AV fistula, and I'll look for the fistula and see for any kind of a fresh pinprick marks.
Yes, you are seeing the. You are seeing the screen?
Yes.
There is pinprick marks present.
Yes, sir. And then I'll just ask the patient and the examiner, can I feel the fistula if it's not painful?
Yes, you can feel.
So I'll be feeling from the dorsum of my hand for the temperature and comparing it with the on the dorsum.
It is raised.
Okay, it's raised. Okay, so and then I'll compare it with the other hand also, and I'll move my entire hand through the whole arm of the patient and to see any other fistulas or any drains which has been put till the axilla and till the neck. Same on the other side. If there are any more fistulas or fistula sites there, so then I'll then auscultate the bruit over the AV fistula.
Present. Okay. And there is a palpable thrill also.
Yeah, okay, sir. Then I'll go in for the neck examination to see for any kind of a lymph nodes.
Absent.
Okay. Absent lymph nodes. Okay, so then I'll auscultate for any kind of a carotid bruit there.
Absent.
Okay, I'll go behind and check for the sacral edema.
Absent.
Look for the chest auscultation for any kind of a basal crypts.
Absent.
And I'll come in front and see the abdomen for superficial and deep palpation.
Okay. Now all organomegaly is there. 2 minutes left, doctor.
So any palatable masses?
Absent.
Okay, and okay, so then I'll come to the legs and so no shifting dullness also?
Shifting dullness is present. Mild ascites is there.
Okay. So I'm looking for the pallor in the eyes and or any jaundice sign, and for mouth sores in the mouth, and
absent.
So pedal edema I'll check, and then Mr. Anderson, may I know what are your concerns?
Doctor, why I'm having this hand pain?
So, Mr. Anderson, I have taken your history and examined you. So, this hand pain could be the pain which you're having in your hand could be because of the fistula, this blood channel which we have created for your dialysis has actually got an outpouching inside. It could be called as aneurysmal. It has got an outpouching inside. That is why it is having pain. Another differential I could keep that it is causing infection. Must have got an infection because of the transient. We are giving the dialysis through this route. The third possibility is that it has got narrowed after the use of the cannulation. So these are the few possibilities, Mr. Anderson, I can keep in my mind right now. Any more concerns you have?
So, doctor, if it is occurring some problem, so how will I take the dialysis?
So for Mr. Anderson, you don't worry about this. So we will be forming a team of doctors in which we'll be consulting our kidney doctors, and they will take the decision after reviewing, after running. We run some test, and they will review with the test and sit with you and decide about how to give the dialysis.
Okay, doctor. So, doctor, do I need admission right now?
Yes, Mr. Anderson, because we have to see whether the team will, after the reports come, the team is going to review your investigations, test reports, and then they will decide. So till that time, we'll keep you here, and then they will sit with you and discuss the management plan.
Okay, and I will keep you here with observation, and in the meantime, I will talk to my consultant. He will come and see you.
Come and
Just
see
don't make him sit.
Okay.
Just talk to the consultant.
Okay. Right, sir.
So time's up, doctor. So, doctor, do you have any diagnosis or differential diagnosis?
So, my diagnosis, I would keep a diagnosis and differential diagnosis also I have. So, my first diagnosis would be aneurysm of the AV fistula.
Yes.
And then, second would be some kind of a local infection. And third, but the thing which goes against it that he doesn't have any fever. And
Yes.
thrombosis also I can keep, but the bruise is there, and I can
Yes.
feel this thing. And the other one was ischemic steel syndrome. Also, we can keep it here. So,
But against that,
I can't. The patient. I couldn't. So pulses. The patient's pulses were normal actually.
and also the patient will feel pain at the distal extremity due to some ischemia.
Okay, sir.
Okay. So, what are the positive physical findings?
Sir, what is against the Still syndrome, you said?
Actually, what happens in the Still syndrome? The blood gets diverted from the distal circulation. So, the distal hand does not get proper blood supply. So, the patient will feel pain at the whole distal part of the hand, distal to the fistula.
Okay.
Are you getting it?
Yeah, okay.
But
so
here the
do
patient
we
is
expect any color changes also or no?
Yeah, there can be color. There can be some trophic changes. There can be some changes like ulceration can be there.
Okay. Thank you.
Okay. So, doctor, what are the positive?
Sir, so this 40-year-old male whom I've examined for the pain in hand for the last 3 days, he is a known case of CKD for the hypertensive as a cause of a CKD, and I could see the working fistula with the bruit and the thrill there, and there were signs of mild inflammation also there, but there was no fever. And rest of the examination, I could only feel the shifting dullness in the abdomen. And there was no negative findings. You said not to say. So there's only one physical finding which I could see, sir, with the fresh needle marks. That is the fist is a working fistula, actually functioning fistula.
Yes, but did you check for the neck scar mark?
So I checked.
You checked for the neck lymph node.
No, sir. I said any marks for any drains for anything for.
Okay, then I have missed it. Sorry.
Sir, I said that, sir.
Okay, wonderful.
For any kind of drains and for any extra this thing for entire. I said, now I'm running my fingers and glancing through the hand of the patient till the neck and seeing any other marks for drainage.
That is wonderful, doctor. Actually, what happens for the Indian patients, due to some complexion, it becomes difficult sometimes to identify the neck scar mark.
Yes, sir.
That is evidence of previous hemodialysis. Okay, wonderful. And also you have to auscultate for the base of the lungs.
So I did that. When I said I'm going to auscultate the base of the lung, when I was checking the sacral edema, I said I want to examine the base of the, you said clear.
Okay, that's right.
I did not auscultate heart, sir. That I missed, that I agree.
No. It is not needed.
Chest, sir, behind the bases I auscultated when you said it's
then
clear.
It is okay.
Yes.
Then it is okay. Wonderful, doctor. And it was not needed to check for the carotid bruit. I
Okay,
think
sir.
you also. So
I did,
it will not.
yes, sir. I did check carotid bruit actually.
Yeah.
I think it was not needed. Probably, I think
Yeah,
I
not
got
needed, but no
confused.
mark will be cut for that. But better to avoid.
Yeah, yes,
This
sir.
will need
Yes,
some
sir.
time.
Right, sir.
So how would you like to investigate?
So, to confirm my diagnosis of the aneurysm of the AV fistula, I will. So, firstly, I will educate and counsel the patient for the.
Doctor, I'm not asking about the management. I'm asking about the investigation.
So, for apart from running for the running basic investigations for the patient, I will do the Doppler of the arm to see about the aneurysm of the status of the aneurysm of the with what we are suspecting, sir, aneurysm of the AV fistula.
Yes.
So the Doppler studies of the limb we have to do.
Yes.
And so that will only reveal us whether it is aneurysm or whether there is a thrombosis. So
Yes.
that will be one finding, one investigation which I would like to do apart from the basic investigations
Then
to
how to
confirm my
confirm the
diagnosis.
cellulitis?
So cellulitis for that.
It's not cellulitis.
So,
they don't want to hear the term cellulitis. They
yes,
want to hear
sir.
AV.
Sir. Yeah, sir. So that was my lower down actually. The local
Infected
infection.
AV fistula. Yeah.
Yes.
How
AV
to,
yes, sir.
How to confirm it?
How to confirm, sir? I'll ask the patient to lift his arm over his head.
No. From the investigation, how to get a clue about the infection.
About the infection, sir. So the inflammatory markers will be raised and we'll take a blood culture for any kind to rule out any kind of a local infection.
Yes. Also at the complete blood count, we have to look for evidence of.
Yeah, some inflammatory markers, the CRP and the ESR would be raised, sir.
Also increase WBC count.
Yes, sir, WBC leukocytosis, and for the cultures, we'll take the culture from the sites before we start an antibiotic course according to the local guidelines. If we are suspecting infection.
That's all, doctor. Then how to manage this man?
So this man will manage by non-pharmacological and pharmacological method. Non-pharmacological, I'll be educating and counseling the patient about his condition and forming a multidisciplinary team, including the nephrologist and about the decision to take this cannulation for the dialysis or not. That will be dependent on the nephrology team. So I'll leave it to him for take the decision on it. And so for the pain, I'll manage the pain with the paracetamol because patient is a CKD patient, so we'll not be giving any NSAIDs.
Yes.
And so that is it, sir.
Yes. And if the underlying cause is infected AV fistula, what will be your management?
So we have to insert an fistula then, sir?
If the diagnosis is infected AV fistula.
So infected AV fistula, then so we'll treat with the local. We'll involve the infectious department team, and according to the local guideline, we'll start the antibiotic after their consultation.
Yes, that will be the answer. So,
any more concerns, Mr. Henderson?
No, doctor. You are talking to the examiner, not Henderson.
Yes, sir.
So, Dr. Kia, are you there?
So she has done it perfectly.
Yeah,
I don't think I have anything to say.
And I think she has become the champion for it. But let us discuss one by one.
So please deduct something. So please deduct something.
And believe me, you are the first candidate who has got full mark in the first session. So this is a AV fistula, and these cases they are at the Delhi Center. Pray to the God that this case come. So also, Dr. Kya, I'd like to add one thing for the performance that you missed to take the family history. Dr. Kia?
Yes, sir. I checked. Sir, I asked the patient.
No, her mother had similar problem.
So
she
you
took
told
the
me
history,
that,
I
no?
guess.
Yes. You said,
okay,
sir.
Then I'm having some encephalopathy. Maybe
Due
that.
to sleep
Yeah.
deprivation, I think.
Then I told her that I'm sorry and all that. I told her that.
Yes, yes. Okay, doctor. Actually, I'm talking for the last 6 hours. That can be the problem. So regarding the physical examination, Dr. Kya, what would be the judgment?
I can't think of anything.
Yeah, tell the it is satisfactory.
Satisfactory, sorry. Yes.
Yeah. Then identifying
And
physical sign. Did
yes,
she miss
yes,
anything?
satisfactory. No, I don't think so.
Then clinical communication skill. She
Perfect.
took the history perfect way and completed all the PDF surgery. So this is
Yes.
satisfactory. And differential
Yes.
diagnosis also
Yes,
satisfactory.
perfect. Yeah.
Also all the things are satisfactory.
Yes.
So point on. So out of 14 from each examiner, she has got 14. And if we multiply it, it will be 28 out of 28. Well done, doctor. Very good, very good. And you're the first candidate who has got 28 out of 28 at the first session.
Thank you, sir. Just your guidance. That's all. I've been just listening.
No, it is just a start, doctor. You have to
Yes,
complete
sir.
it.
Yes,
There are
sir.
lots of ways to complete.
Yeah, sir. That's it. Yes, I think everybody scored good today because I think it's a musculoskeletal. It's good that, sir, you kept a very little less heavy topic today. Well, had it been neuro or anything, then we would have just gone for a 6 actually.
No problem, doctor. So from right now, you have to practice with Dr. Kia. And Dr.
Alright.
Kia has to practice with you. And you
Okay,
have
sir.
to judge each other using this mark sheet.
Right. So
Okay?
can you post this mark sheet somewhere so that we can have
Yeah,
it?
I have posted it in the group. In the active group, I have posted the mark sheet. Have you not checked it, doctor? I have posted the PDF sheet and also the mark sheet.
So I know I've logged in with my iPad, though I'm not seeing my phone.
Okay,
I'll
I will
see.
send you. I will send you another. Please make me a knock at the inbox. I will send you at the WhatsApp again.
Right.
Okay.
So, sir, why they say not to keep local infection as a this thing? They don't want to listen that, sir.
Which one? I
Cellulitis.
didn't get.
Cellulitis, sir.
Yeah.
Oh.
I don't know for what reason, but I have seen the feedback that they don't want to hear the cellulitis. They want to hear infected AV fistula. It is directly from the feedback from the Delhi.
Right, sir. Okay.
Okay.
Right. So then what is the treatment for this? Otherwise, aneurysm of the AV fistula, how do they treat? There's a surgical this thing only.
Yeah, this will be taken care of by the vascular surgeon and also the nephrologist. This is not my job. I have to
So
form the
we will just say nephrologist only, and a vascular surgeon also we should mention.
Yes, because the fistula is of the vascular surgeon's task.
Okay. Right.
Okay.
Sir, can we say thrombophlebitis?
Actually, doctor, we can say, but what I found from the feedback that they prefer to hear the infected AV fistula.
Okay.
That is why I'm telling, doctor. I'm telling from the feedback, actually. Better to tell this. So
if there is a fever, then only we can say infected. If there is no fever, then we will not say. But if there is a fever, so obviously, sir, then definitely we have to say that could be an infected AV fistula. No, sir.
But there can be localized redness without fever.
He is CKD, so maybe immunocompromised.
Yes, doctor. That is the answer. And there is localized redness there.
Right, sir.
Okay. So let me go to the next candidate. So Dr. Nozrul, are you there?
Yes, sir.
And
I just have one question. As this looks infected, should I put on gloves before examining this? As there is open wound?
Yes, better to offer it. Better to offer it. It will prove you as a professional. Look, the way you have become professional, it is only the matter of practice. If you judge each other using the mark sheet, automatically you will improve. So apart from Dr. Nozrul, I'm not finding any other active participant. So please make a noise if any other active participant is left out. Because I think
what is my status?
So can you please tell me your name? I'm not.
Suhas.
Suhas. Okay,
Suhas
okay.
Patil.
Oh, doctor. Oh, doctor. Dr. Suhas, how are you, doctor? Okay,
Yeah,
let's practice a case. Actually, with Dr. Nozul there. Let's practice a
Yes.
case there.
Yes.
Actually, there are only 8% charge left at my iPad. I'm not sure whether it will be there or not. Sorry, doctor, I did not know you earlier because he was logging in with another name. So right now I'll give a case to Dr. Nozrul and Dr. Suhas has to make the judgment. Sorry. So can you see the screen, Dr. Nozrul?
Yes, Dada.
Okay. This is your case and you have to practice and Dr. Suhas will give you the judgment.
Okay, Dada. Give me 2 minutes.
Yeah, doctor.
Okay. Hello.
Yes. Are you ready, doctor?
Yes.
Okay. Just give me. Yeah, start, doctor.
Hello.
Hello.
I'm Dr. Nozrul, one of the doctor working here today. Am I talking
Yes,
to
doctor.
Mr. Watson?
Yes, doctor. I'm Mr. Watson. I'm 65 years old.
Nice to meet you. Today I am here to talk regarding your health issue and to examine you. Is that okay, Mr. Watson?
Yes, doctor.
Okay. So during our conversation, I might take some notes, but be sure this will remain confidential and my full consultation will be with you. Is that okay?
Yes, doctor. It is okay.
Okay. Mr. Watson, in your own language, would you please tell me what brought you here today?
Doctor, I'm having some pain at my right knee joint for the last 3 days. It is increased to such extent that I cannot move my neck, doctor. Please help me, doctor.
Okay. Sorry to hear, Mr. Watson. At the end of our conversation, I will give you some painkiller medication for temporary relief for your pain. Is that okay?
Okay, doctor.
Okay, let me ask some more question. How did it start?
It started gradually, doctor.
Gradually. So, for how long this pain?
It is there for the last 3 days.
For the last 3 days. So, is the first time this pain happens?
Actually, doctor, I'm having pain from earlier. I'm having pain for both my knee joints. And it's more of the right knee joint, but suddenly the pain is increased at the right knee joint for the last 3 days. I don't know what happened exactly.
Yes. So, anything that worsened this pain?
Doctor, I cannot move my leg, doctor. I'm even not able to notice what worsened is.
Anything gets better?
No, doctor. I have tried for paracetamol, but it is not improving my pain.
So, do you have any pain in any other part of the body or any joint?
I also have pain at my other joint, and this pain is there from earlier.
Okay.
At other knee joint.
So, Mr. Watson, if you asked to score that pain on a 0 to 10 scale, how much you will score?
It is 6 out of 10, doctor.
6 out of 10. Okay. So, is there any morning jamming?
No, doctor. There is no morning jamming there.
No morning jamming. Okay. So, Mr. Watson, let me
Yes.
ask some question.
Yes, doctor.
So, whatever diet,
I take balanced diet, doctor.
balanced diet. So, do you have any significant past medical history that I should be aware of?
Yes, I have diabetes.
You have diabetes. For how many days?
It's been diagnosed for the past 2 years.
Okay. Any other long-standing condition?
No, doctor.
So, what about your medication?
I'm taking medicine for diabetes, that is metformin, twice daily, 500 milligram twice daily.
So, do you have any raised body temperature?
Yes, doctor. I'm having some raised body temperature.
So, is there any injury to any part of your skin or any joint?
Yes, doctor. Actually, I was gardening. I was doing some gardening at my garden. I love it. So during doing gardening, it was sorry, no. There was no injury, doctor. There was no injury. Sorry. Hello? 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 Dr. Nosrul, can you hear me? Am I audible? Or again, I have lost my connection.
Hello, I think he's muted.
Oh, okay. That's good. This time I have not lost the connection. Dr. Nosrul, can you hear me?
Hello, am I audible?
Yeah, right now you're audible, doctor.
Okay.
So there is no history of injury, doctor.
Oh.
Please start.
Yes, start.
Yes, proceed with the format. Ask all the past medical questions. What is necessary?
Okay. Medication. Do you have any allergy to any medication?
No, doctor.
Okay. Do you have any previous hospital admission?
No, doctor.
Any history of blood transfusion?
No, doctor.
Any history of surgery?
No, doctor.
Any recent procedure?
Yes, doctor. 5 days back, I had a procedure to my knee joint. So, doctor, I had some knee joint pain. It was some wearing and tearing pain. And to control the pain, the doctor did introduce some thing inside my knee joint.
How many days ago that happens?
It happened 5 days back, doctor.
5 days back. So,
Yeah.
doctor introduced some medication through needle.
Yeah, through the needle. And it was told that it was to relieve my pain. Because I was having
pain.
Yeah, as I was having some severe wear and tear of my joint.
So, Mr. Watson, do you have any family history of any significant disease that runs in your family?
Yes, my mother also used to have diabetes.
So, any other family member have the same similar condition?
No, doctor.
Okay. Do you smoke, Mr. Watson?
Yes, doctor. I like smoking.
Okay. So any amount of smoking is injurious to health. So I would advise you, if you want, I would like you to refer you to the smoking cessation clinic. Is that okay, Mr. Watson?
Okay, doctor.
Okay. Do you drink, Mr. Watson?
Yes, doctor. I drink.
Is that within social limit?
Yes, doctor. It is within social limit.
Social limit. Do you binge, Mr. Watson?
No, doctor.
Okay. What do you do for living, Mr. Watson?
Doctor, I'm a retail banker.
Retail banker. Does this pain has any impact in your daily life or in your job?
Yes, doctor. This pain is creating so much problem that I cannot continue my daily activity.
Okay. So, Mr. Watson, do you want any compensation?
Not right now.
Any help from the social worker?
Yes, that will be better, doctor. That will be very much helpful for me.
So, in that case, I will refer you to the responsible authority to help you and for your betterment. Okay.
Okay, doctor.
So, I want to examine you.
Okay. What do you want to examine?
So, first, I'll examine your knee joint.
Okay. What do you want to examine at the knee joint?
So, at first, I look for any swelling or any redness.
Yes, there is swelling present.
Then,
with redness.
I want a glove to examine the joint.
Okay. Provided.
So then I would feel for the temperature, tenderness.
It is raised. How to feel for the temperature?
So I will ask if there is any pain, and with gentle technique, I will feel is there any I will compare the knee joint with the normal part.
With
forearm.
What is the normal part? Which part?
With the thigh.
Yes, it is not. It is raised.
Then tapping of the knee joint.
Yes, tapping is positive. There is effusion present.
So if the patient allows, I would like to see both the active and passive movement.
It is restricted due to the pain.
Okay. So if the patient allowed, I would also like to examine the body temperature.
Okay, it is raised.
It is raised. So I would examine the whole skin for any survey, any other breach of continuity in any part of the skin or any joint.
Okay, noted, doctor.
Okay. Okay. So
2 minutes left, doctor.
I'd like to measure the bedside blood sugar.
Okay, noted.
Okay. I'll examine the gait of the patient.
Okay, patient cannot walk.
Okay. So, Mr. Watson, do you have any concern?
Doctor, why I'm having this knee pain?
So, what happens to you, Mr. Watson? Please let me tell you. So you have sore joint, and the doctor tries to mitigate this pain with some injectable medication within your joint. That procedure might introduce some bug inside your joint that causes the joint to sore more and get infected. So in our medical language, we call it as septic arthritis.
Doctor, do I need admission?
Yes, Mr. Orson. It's better we'd like to admit you. And
Okay, doctor. Thank you very much. So your time's up. So, doctor, do you have any diagnosis or differential diagnosis?
so I have a diagnosis as
Okay, what is? Yes, doctor.
okay. Mr. Watson has septic arthritis, as he has clear history of rare tender swollen joint and with a past history of needle insertion within the joint.
Okay. Any other differential diagnosis you want to consider?
Yes, gout.
Okay. Against that, anything have you got?
Against that, as there is the temperature of the joint is raised in comparison
And
to
there
the
is,
thigh and redness.
and also from the history, there is nothing goes.
Nothing risk factor. Though the patient is diabetic, but no other risk factor like any drugs or diet.
Yes. So you have to tell like this to the examiner. And whenever telling, try to speak in a confident manner. And it will automatically develop if you practice very frequently.
Okay.
Okay. So what are the positive physical findings?
So the positive physical finding are red, hot, tender joint, knee joint.
Yes. So any other
That I
positive
have
physical
and raised
findings,
body
doctor?
temperature and raised body temperature.
Any other positive physical findings, doctor?
There might be a fresh needle mark for the intra-articular injection of the procedure.
Doctor, you have fallen into the trap. This is just to check your confidence. Sometimes it is done at the basis exam to make you synthesize some finding. Even after telling the positive physical, positive physical findings, they just ask you any other positive physical findings, doctor, and you have fallen into the trap. Have I told you that there was any needle trap mark?
No.
So don't fall into the trap. Whatever things you have got, just tell in confident manner.
Okay.
Are you getting it, doctor? Sometimes it happens with a dummy case. Like the patient is having hematemesis. This will be a dummy case with the taking of NSAID, and the patient, something like that, the patient has taken painkiller but forgot to taking the PPI. And due to some repeated hematemesis, and it will be a dummy case. It happens in case of Delhi and many other centers. So the examiner will ask you any other positive physical findings to make you synthesize the anemia. But in real case, in the basis exam, whenever it is due to the NSAID-induced hematemesis, there will be no anemia. So if you synthesize any finding, like the patient is having anemia, wonderfully you will lose your mark in the identifying physical sign. Are you getting it, doctor?
Yes, brother.
So don't fall into the trap. So what are the investigation you would like to do?
So first of all, I'd like to check the patient's prothome time and INR to
Doctor, professionally. What you have to start with?
First of all, to confirm the diagnosis, I would like to have an X-ray of the joint.
No, doctor. What will be the initial thing you have to tell for every investigation?
Besides the basic investigation?
Yes, doctor. And
Apart
if
from
you
the
remember,
basic investigation, I would like to investigate the patient, aspirate the joint, and send it for examine under the microscope.
Yes, and also check for the microscopy and culture sensitivity.
Microscopy and culture sensitivity. And complete blood count, extra of the joint.
Yes, doctor. You have to tell like this.
Then,
if you remember, I have told you in the last session that apart from basic investigation is the commonest mistake that the candidate take. If you notice today's practice, many candidates miss to tell this thing. So never forget to tell this thing. Otherwise, the mark will be cut for sure. So then, doctor, proceed.
Then to see the association, I'd like to know the full blood fasting blood sugar and HbA1c.
Yeah, that's all. And from the complete blood count, I'd like to exclude leukocytosis.
Yes.
Try to tell it, doctor, again and again. Practice with the partner.
Okay. Okay.
So how would you like to manage?
So I'd like to admit the patient and
Yes, then.
manage with ABC protocol, and then
Yes.
patient education and counseling, form a multidisciplinary team, give some painkiller medication to the patient, and giving IV antibiotic. And
Wonderful.
keep the
That's
patient
all.
under follow-up.
That's all. This is simple. Okay. Now let us start analyzing your performance. So Dr. Suhas, are you there?
Very poor performance.
Hello, yes, sir.
Yeah. So let us analyze doctor's performance.
Yeah, I think overall he did quite well.
Yes.
He very confidently told actual diagnosis, which instead of giving importance to differentials, I think that was a very confident decision.
But you have to keep the
Overall,
judgment according to the skill.
yeah.
So regarding physical examination,
what I thought is that since we are keeping a differential diagnosis of gout, we should have asked
yes.
about BMI, body mass
The
index.
patient, yeah. Suppose the patient is not overweight.
Okay. Second thing, since the patient was telling there was a background history of both knee pains, we should have
Yes.
examined the other knee as well.
Yes, it is better to examine. Good, doctor. Wonderful. Examine the other knee.
Yeah. So
To
I
look
think,
for,
I'm sorry.
what we have to look for at the other knee?
Look for any crepitus, tenderness,
Yes.
and swelling, joint swelling.
Yes. Now let me tell you one thing, doctor. Yes, it is better to examine the other knee. But in real life, has the patient come to me for this problem? He has
No.
been already diagnosed with osteoarthritis earlier. So right now he has come to me with problem at the other joint. That is a septic arthritis. And he has a diagnosed case of osteoarthritis beforehand. So is it necessary to examine the other knee? It is that much compulsory?
I don't know. Yeah.
Think in practical
exam
terms.
wise, maybe it is not that necessary. Yeah.
Yeah. Think in practical terms for the UK.
Yeah.
The patient is already diagnosed with osteoarthritis, and right now he has come with some other complaint. So our focus will have to be on that. But if we examine the other knee, it is better.
Yeah.
But I think it will not cause any harm any mark.
Yes, sir.
Are you getting it?
Yeah.
What is the logic here?
Because that thing is not relevant to the examination at the moment.
Yeah, the patient has not come to me for this complaint, and he has already been diagnosed with osteoarthritis. So I don't have to diagnose the osteoarthritis right now. Whatever findings I will get, I will find that crepitation that will indicate osteoarthritis. That is already identified by some other physician.
Yeah.
That is the logic. So
yeah,
if you examine the other knee, if you examine, it is okay. But if you avoid it, it is also okay.
Yeah.
Are you getting it, Dr. Nozrul?
Yes, sir. Yes.
Okay. So based on this, what will be your judgment?
I think he offered a gait assessment as well.
Yes, he offered.
Yeah. So it should be satisfactory. Yeah.
Okay. Then identifying physical signs.
Yeah, I think he identified physical signs, but probably makeup sign, I don't know. I mean,
yeah, he makeup signs.
Yeah.
Any synthesis of any findings will harm all the mark in the identifying physical signs. That is the rule of the PACES exam. No synthesize. So as he has synthesized one finding, what will you tell?
Unsatisfactory.
Yes, doctor. This is a learning. Because what happens in the native exam, we have to match the findings, but it does not happen with the PACES exam. Then clinical communication skill.
Yeah, I think he explored all the history properly.
Yes,
I think only regarding diabetes, maybe some more exploration could have been done.
Actually, doctor, it is for 2 years only. If I could tell him that it is for 15 years, then he has to exclude the diabetic complication.
Okay. Yes, I agree. Yeah. So it should be satisfactory. Yeah.
But one thing he has missed, that is medication allergy.
No, I think he asked allergy. Yeah.
He asked it.
Yes.
He asked allergy. Yeah.
That I missed it.
Yeah. He asked allergy.
So,
yeah.
Okay. Then this is satisfactory. Then differential diagnosis.
I think satisfactory only.
Yeah. Then clinical judgment.
Judgment also good. Yeah.
Yeah.
He offered admission to the patient. He followed
Yes.
the multiple disciplinary team properly. Yeah.
Yes, doctor. And also started antibiotic after taking consultation from the infectious disease.
Yeah.
So the rest is also satisfactory.
Yeah.
So based on this, out of 14 from each examiner, what will be his mark, doctor?
12.
Yes, 12. So if we multiply it into 2, it will be 14 out of 28. Have you got it, Dr. Nozru?
Yes.
Well done. Yeah.
But the thing is that you have to practice for multiple times to increase your fluency. You have touched all the things. Only the fluency matters. And it will automatically develop if you do regular practice. So from right now, you have to practice. If you want, you can take help of Dr. Suhas.
Okay.
Actually, Dr. Suhas has joined as a listener. He is not part of the active course. So you will find him at the listener group also. So right now, you have to practice with Dr. Suhas and make you judge each other using the mark sheet. Are you getting it, doctor? Partnership is the main in the PACES exam. If you want to pass the exam, you have to make partnership. And
Yes.
from myself, I'm trying my best to make some partnership between the candidates. And Dr. Suhas, Dr. Nozrul has also got seat in this diet. He is a candidate for the Dhaka Center, and Dr. Suhas is a candidate for the Delhi Center.
Yeah.
Okay, now it's time for Dr. Suhas, but I am not sure whether this 2% charge will allow. Okay, let's proceed. Let's see how far can we go. So I'm again begging pardon if the connection gets lost because there's only 2% charge left. We're starting, and right now, Dr. Nozrul will be the examiner for Dr. Suhas. So this is your case, Dr. Suhas. It's try to be some hurry because anytime my iPad can get switched off. Have you seen the screen, doctor?
Yes, sir.
Okay. Are you ready, doctor?
Yes, sir.
Okay, start.
Yeah. Hello, I'm Dr. Suhas. I'm one of the medical doctors in the clinic today. Can I confirm your identity, please?
Doctor, I'm Mr. Anderson. I'm Mrs. Anderson. I'm 40 years old, doctor.
Yeah. How may I address you today?
You can call me Anderson.
Okay. Anderson, we are here to discuss regarding your health condition. Are you comfortable?
Yes, doctor.
Do you want someone to join this discussion or I can continue?
You can continue, doctor.
Okay. So Anderson, may I know what brings you to the clinic today?
Doctor, I'm having some hand pain, doctor. It's bothering me a lot. Please help me, doctor.
I'm so sorry to know that. I will try to help you as much as possible.
Okay, doctor.
Do you need any painkiller at the moment?
No, doctor. The pain is not there right now.
Okay. Yeah. So how long you are having this pain?
It's been there for the past 15 days.
Okay. Is it getting worse or it is the same?
Doctor, it comes and goes, doctor.
Okay. Have you noticed any color changes?
Yes, doctor. It
Okay.
changes color.
Yeah. May I know what color changes you have noticed, right?
Like whenever I expose to the cold, it becomes pale, then blue, then red.
Okay, fine. Anything which makes this pain worse?
After exposure to the cold, it becomes more worse, doctor.
Okay. And anything it makes it better?
Whenever I come inside the home, I think it gets better, doctor.
Are you using any protection for your hands?
No, doctor.
I would suggest you to use some protection whenever you are going in cold. Is that okay?
Okay, doctor.
Yeah. Do you feel any weakness in your hands?
No, doctor.
Any skin breaks or ulcers you have noticed?
I didn't notice. You have to check.
Okay. Is this problem affecting your day-to-day activities?
Yes, doctor. It is also affecting, doctor.
Okay. Have you noticed any morning jamming in your hands?
No, doctor.
Okay. Do you feel any tingling or numbness in your hands?
No, doctor.
Okay. Do you feel any difficulty in lifting your hands above shoulders?
No, doctor.
Okay. May I know any long-term health condition I should be aware about?
I have high blood pressure.
Okay. How long?
It's been there for the past 2 years.
Are you using any medications for the same?
Yes, doctor. I'm taking losartan 50 milligram for that.
Okay.
And also, I'm having some mood problem. And for that, I'm taking medication called citalopram and also propranolol.
Okay. Yeah. And okay. Any medications recently started or stopped for you?
No, doctor.
Any surgeries or procedures you have undergone?
No, doctor.
Any blood transfusions?
No, doctor.
Any allergies to any particular medications?
No, doctor.
Okay. Any over-the-counter medications or herbal preparations you are taking?
No, doctor.
I'm sorry to ask, but do you use any party drugs? Hello? Hello?
I think this iPad charge gone.
Yeah, maybe, yeah.
Should we continue?
Yeah, I don't know what to do now. Yeah, because he is going to give me the answers now.
Okay. You're on up to drag history.
Yeah.
Let's see.